Recording in progress.
There you go. To check out our new room, this is a beautiful room. They did the carpets, the paint, and we have some new technology, which is fantastic. So, but I wanted to open up our strategic planning retreat for 2023. Today is November 9th. And let's go ahead and have roll call and determination report.
One second.
Here.
One moment, please. 1 moment.
They should officially tap that. That makes it real.
You got on that recording.
Okay.
Okay. Chair Adair?
Here.
Vice Chair Devin Reese?
Here.
Commissioner Garcia? Here. Dr. Danko? Here. Michael G. Brown?
Here.
Dr. Klocking will be in late, and Dr. Novak is absent. Chair, and I'm your recording secretary. We have a quorum.
Very good. If you don't mind standing for the Pledge of Allegiance, and we're going to have soon to be Dr. Robert Fida lead us if you don't mind.
I pledge allegiance
To the flag
of the United States of America and to the
republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Do we have our agendas? Do we have anything, questions, anything want to move, or do I have a motion?
Motion to approve.
First, got a second? Second, all in favor?
Aye.
Any opposed? That passes unanimously. We'll go ahead and go to public comment.
Okay, we have no registered public.
No public comment? Very good. We're going to go ahead and move to consent items. We've got a few things on there. Does anybody want to pull anything, or are we good with both?
Motion to approve.
First, second. Second. Any more discussion? All in favor?
Aye.
Any opposed? That also passes unanimously. Check that out. We're moving. So let's go ahead and begin with just some introductions. Talk about discussion of flow, what's going to happen. So I think some of you might have heard our health officer, Kevin Dick, is stuck in the world of flying and not get out. So he apologized, he cannot be here. But I told him that we're fine. We got Aaron, so everything's fine. But we have a good team here, and I know that he's put a good team together. So I know he was pretty bummed he couldn't be here. My only encouragement really for today is that I think this is my 7th strategic meeting that I've been through. And this is a great day for us to really hang out with staff, a great day for us to hear from staff, also to hear from us. A lot more, I say this, if there's questions, I'm not really so concerned that you look to me to open up that question. I would actually challenge y'all to ask more questions than usual. Like sometimes we're going through a meeting, we're like, trying to get through it. And today we don't necessarily need to go till 12 o'clock. That's not the goal. But at the same time, we want to just make sure we open that up. So if you have something on your mind or a thought, let's make sure it's on the table and make sure we get to hear from everybody. So with that said, do we have staff here? Do you want to go around and do introductions of who's who? That'd be great. So I will, you want to go ahead and share what you're going to share first? Or should I do it? Okay, very good. I know Erica Olson is with us, and so thank you for being our guest here today. And so she's been working with us for years and years, so thank you for your continuous. Miss Julia Ratty and everyone else, she'll actually be helping leading some of this stuff. And then with that said, I'll just kind of let you go around the room, say what you do.
My name is Robert Fido. I am the Environmental Health Services Director. I oversee the environmental health permitting, so food facilities, waste management, safe drinking water. I'm going
to add one more thing just for fun and get started with you. What's your favorite ice cream?
Mint chocolate chip.
Mint chocolate chip. That tells me everything I need to know about you. There you go.
Oh, coffee, buzz, buzz, buzz.
Wow.
It's Ben and Jerry's flavor.
Chocolate chip cookie dough.
There you go.
Mint chocolate chip.
And then you tell them.
Scott Oxerard, I'm the communications manager here at Northern Nevada Public Health.
Rika Danko, I'm a physician on the board, and I'm the chief medical officer of St. Mary's Hospital. I don't actually like.
Wow.
Did you say she doesn't like ice cream?
You don't like ice cream?
If I did, I'd have to go with like a pretty decent.
Do you like sherbet?
Yeah, maybe like sugar.
Now, that does count everything we need to know about you, but that's cool.
Hi, Lisa Lafferts, Division Director for Community Mental Health Services. So I oversee the clinical operations, WIC, and chronic disease injury prevention. And my favorite, can I do two? I want to try Julia's.
She's not sharing.
Mint chocolate chip, and I love coffee as well.
By butterscotch.
So good morning. My name is Erin Dixon. I am the Deputy District Health Officer. I work directly with air quality, administration, environmental health services, and community clinical health services. And while I am a fan of coffee for 9 months, we're heading into peppermint ice cream season.
Gotcha.
Be my favorite for the next 9 months. My name is Garcia. I'm 11 months in as the Washoe County Board of Commissioner. I can't even talk, so you can tell how fun that's been. My first annual retreat, and I have to go with Ben & Jerry's Happy.
I'm Jack Zentino. I'm the Administrative Health Services Officer. I do all the budget stuff. I do human resources, and I do the technology services pieces. I'm going to go with Dr. Danko. I'm not a big fan of ice cream, but anything that has to do with a fruit flavor during the summer would be
Good morning. My name is Devin Reese. I am the Reno City Council member at large, and of course, here as the vice chair. I am not a serial killer, so I love ice cream. Mint chip is the preferred and best ice cream. There is no debate.
Wow, strong words back.
I'm now the division director of epidemiology.
Copy that.
So programs under ours is epidemiology, public health preparedness, EMS oversight, vital statistics. My favorite ice cream, well, I have a lot. I do love ice cream. I like cherry vanilla. I like raisin rum. I like maple pecan. And there's a new one I discovered recently called cereal milk.
Actually, I've had that.
Yes,
That's pretty good. You've been to New York, because New York has that. That has a big.
Mike Brown, I'm the Reno City at Large representative. And you know, a lot of you know I'm from the fire service, and the fire service ice cream is stuff that's always in the freezer. Every one of the refrigerators there, because we either get paid each other off on it or. But I'm not a big fan either. 1 month out of the year, December, I do peppermint because I like the peppermint candy that comes during Christmas. So December is my year for peppermint.
Francisco Vega, Director of the Air Quality Management Division. Primary functions under our division are monitoring, planning, permitting, and compliance. And favorite ice cream, basic chocolate.
Yes, chocolate.
Morning, Mary Candaris, Chief Deputy District Attorney. And classic for a reason, vanilla.
Let me out there. Favorite ice cream? My very first job was Baskin Robbins.
Wow.
I'll tell you how long ago that was, but it was a long time ago. They had, so, sorry I'm late, first of all. They were back up at the boarding. I'm flying out to visit my daughter in San Diego, who lives right across the street from the Baskin Robbins. So I'm a pistachio, pralines, and cream guy, but still fascinated that when I was at this job, when I was in high school, chocolate mint was the highest selling ice cream from Baskin Robbins, and it still is to this day. You know, also been a Jerry's fan. I've been to the plant in Vermont right after it opened a long time ago, so I made a trip there. And they just came out with an ice cream. I don't know what it is. Maybe somebody knows here, but my daughter's just going crazy over it. Something new. I don't know what it is. I can't remember, but you might want to check it out.
So him and I have something in common. My first job at 15 was Baskin Robbins.
Yeah.
There, Baskin Robbins. There you go. Got a few.
Wow.
Get the white chocolate.
Job.
Yeah. I couldn't go over there and go around.
Chair, just for the record, I showed Dr. Clocking showing up at 8:40 a.m.
Thank you very much. Wendy, introduction?
Oh, that's too.
Oh, yeah.
Floriana Alvarez, business technologist. I work primarily with PHP and COVID unit. Favorite ice cream? Pistachio.
And I'm Susie Valdespin, admin assistant to Health Officer Kevin Dick, and your recording secretary. And my favorite ice cream is Cherry Garcia.
Steve Fisher, business technologist for Administrative Health Services, CCHS, EHS, and air quality, and chocolate chip.
Brianna Lavoie, management analyst for the district health officer's office. And my favorite ice cream is pie cake batter.
Very cool.
Good morning, everybody. Joelle Gutman Dodson, Government Affairs, and my first job was TCBY. And I loved the white chocolate mousse, frozen yogurt, but ice cream I'd have to go.
Come on, gentlemen. You don't walk in the room and don't participate.
All right, I'm Dave Solero, Assistant County Manager, Washington County Liaison to the Health District. And once a year around Girl Scout cookie time, they have Thin Mint chocolate. That's a really good ice cream. So it's my favorite.
Eric Brown, County Manager. I don't care for ice cream.
Well, we still care for you. We have our bodyguard in the back. What's your favorite ice cream?
I like that ice cream with the little cherry pieces and the little chocolate chips. Yeah, that would be.
What's the name of that? Did you make that ice cream?
No.
Okay, I've had enough fun. Now back to other fun.
Well, first of all, I just want to thank everyone for taking the time to come to our strategic plan. And we get this opportunity once a year. And it is really valuable for our team. What we're really hoping to come out of with today is really a basic understanding that we're all on the same page, that we have the guidance to move forward as we start moving forward with some of the items that you'll see on the agenda. And Erica will lead us through the agenda. But if there's any additional considerations that you'd like us to take into account or something of that sort, really this is what we're looking for. And we really want to make sure that as we head into the budget season, that we have that understanding of your guidance and the direction. I do also want to specifically thank a few people for making this room happen. This is really exciting for us in this room. I don't believe this room had been revamped in my entire 20 years here. Lisa's been here longer. You think it had ever been remodeled or painted?
Not remodeled. We did get the closest thing was when we got the new tables and chairs.
Right. So getting this new technology and the carpet and the paint, and then the new lobby outside. And I know during a break we'll have the opportunity to go tour the lobby as well. So thank you. I'm not gonna name everyone, but please thank you for those that really made it.
The floor is Eric.
Yep, I'll roll through, but Julia, go ahead, you get something to add.
Yeah, so I just want to, Dr. Clacking just asked me this question, so I wanted to just do a quick orientation to this retreat, and that it is different than the ones we've done in the past. So for some of you who've been here for 7 years of retreats, or at least the last few, so just as a reminder, with our strategic planning process, we have moved to a 3-year strategic planning process. We are in the first year of our strategic plan. We made improvements to that plan based on our learnings from our performance management system at the September board meeting. So this meeting is not set up to do more strategic planning. It is set up to have some strategic conversations. You may recall the last retreat, you had a lot of pre-reading. There was a lot of content because we had our results of our CHA, we had our health equity listening tour, we had the national work that we were looking at on foundational public health services. So it was very content heavy with external and internal information to make strategic direction. This retreat is very process heavy. So you didn't have any advanced reading. You're welcome. But it's all going to be about process. And we really are looking to make sure that there's a good understanding of the processes that we're using to lead to decision-making and recommendations that we'll be bringing forward to you. So it's a little bit different approach. Dr. Klecking had asked, where's all the rest of the staff? Because typically we have all of our supervisory staff sitting in the back to be able to answer those subject matter expert questions that we may not be able to answer at the table. But because we're not diving in necessarily to a programmatic function or a programmatic strategic direction today, we did let them stay in their offices. Many are monitoring online. We can pull them down if there's a question, but we did not ask them to come sit in the room with us. So that's the main reason. We're doing more of a process conversation, less of a.
Yeah, so tagging on to that, just a little bit more stage setting, and would you flip to the agenda? Yep. A little more stage setting. So the headline for today is the outcome is to walk away with a deep understanding. I'm getting almost there. With a deep understanding of the budget situation, the workforce situation, information that we have for you related to data and governance. And that will be the basis and the foundation for big decisions coming forward as part of the budget cycle, which is January-ish, right? Okay. And so we have enough time to take the time to go deep in the areas you want to go deep, make sure that you have the background that you need to provide that foundation for the upcoming couple of months. So we're not overpacked in our time today, so that's really nice. The directors and the team did a ton of work coming into today to make sure that the stage is really, really set. So we can have this conversation, which is really cool. So we're really looking forward to it. Just to acknowledge all of that. A couple of things that are also worth noting is while the mics are hot, it's actually a little hard to hear in the room. So if we could just over project, that would be great. When some of the presenters will come up here too, so I think that will be helpful as well. How we're going to spend our time, we're going to start with a conversation related to information and governance. You receive a lot of information from this team. We have a new set of information to share with you. We're really excited to walk through that. The intention and the ask there is, do you have what you need from a governance perspective from the team? What's helpful, what's, if there's something that's not helpful, or is anything missing for you. So, and then again, just foreshadowing, there's a new thing to show you. So we're excited about that. We'll roll from there into a fiscal overview and outlook. That is a chunk of conversation. So let's just know that heading into it. It's great, really well done, and be really, really helpful to understand the resources from a financial perspective that district has to work with. And then the workforce and investment piece is knowing all of that. Here's what it might look like, and here are some considerations and thinking about how we are organized and building capabilities and capacity to deliver against the strategic goals that you all set forth last year. So really cool, money and people. And if we have time, we'll talk about succession planning. That is time permitting. If it doesn't, if we don't have time, if that go on an upcoming agenda. So, and board discussion's a little bit misplaced. Our intention is to, of course, have that throughout the whole retreat. It's intended to be retreat-esque and not so formal. So, do we officially need to open up the agenda item, or we already did that?
Let's go ahead. I think we already did. We already did when I began. The way this is designed, just so you guys know, is we have it all on one item 6. So at the very end, if there's an actual formal direction we need to give, we'll vote at that time. We may not even have that. It's maybe more conversational in nature. So just keep it in mind. But if we get to that place and it deems by our attorney over here that we need to do that, or we think this something needs to be a little bit more because of our discussion, we'll do that. But we'll kind of let it flow. And that does mean we can kind of move in between them a little bit if needed.
Yeah, that's great. Fantastic. So with that, let's jump into the first discussion area, which is information and governance. Julia is going to lead us through with the division directors, and really what we want to go deep and share with you a new product. I'll just call it that for a second. And with that in mind, wanting to make sure that you all have the information that you need to govern effectively. That's the backdrop. So with that, Julie, I'll turn to you.
Great, thank you. So this is actually, I have the title at the beginning, but it's actually a group conversation with the division directors sharing some of the work that we have done here. just to do an overview, we believe that these are the signature reports that you get on a regular basis in terms of being able to have your ability to govern as the District Board of Health, but also our transparency to the public. And so we wanted to walk those through with you and make sure that we're meeting your needs. So you're very familiar, every month you get a monthly division report. That is the best place for you to get information about a specific division in that division's lane, if you will. There's always program updates or current information about what might be happening in that division, but there's also usually a data set at the bottom of that that is very specific to that division. So that's a monthly piece. You get, you've seen it at the end of our District Board of Health meetings. Each division director comes up, has the opportunity to share anything that they may need to tell you, and you have an opportunity to ask some questions specifically about their division. Then moving on to our performance management system, and something that you all know that we've been doing a lot of work on over the last 2 years to get to a place where every program has performance management indicators. And we have been doing that through the ClearPoint software system that we've invested in, and a lot of coaching and mentoring and talking and working through to get these to a place where I think that they're pretty tight. One of our learnings this year was that we have a performance management indicator. So I'll just use an example. I'll just go ahead with building plan reviews. And so the building plan review performance management indicator might be that the percentage of those plans that get completed within a jurisdictional best practice timeframe. So it's kind of a customer service performance indicator that we're turning around in a prompt way. What we were noticing in our reporting is you would get an indicator that would say 90% of them were produced in that, or were reviewed in that time frame, but you have no concept of how many there are. There's no context to that. And so we've gone through the performance management system and we've added volume indicators for each of those. So that's just a counting of things, right? But next to that performance management indicator that says 90% were hit within the proper time frame will now be a volume indicator that says how many plans did we review, so that you and the public have context. On the report, you saw that they're just a black dot, not a red, yellow, green if we were on target or performing, because we don't want to give ourselves credit just for doing things or counting things. So they're not added into the scoring of whether we're on track to meet our strategic goals. They're just there for context, if you will. So those you get quarterly. And one of the things that we would like you to consider is right now we are putting the staff through it a little bit to make sure that you get those the very first month after the end of the quarter. So right now, if the first quarter ends in September 30th, we are making sure that it is ready for the October board meeting. And with posting deadlines and everything that goes along with that, it basically means we have 5 days at the beginning of the month to collect that data, turn it around, and get it in a report to you. What it also means then, therefore, is we're not doing much of turning from data to insight, because that's just too short of a time frame to really do much, or doing any mentoring and coaching about how that data could be shared a little bit better. So what we'd like to see is your acceptance level with, would it be okay if those reports were coming the second month after the end of the quarter? Because we think we would give you, we do better management and leadership around that data, but also we would have more insight to share by the time we're sharing it. So that's a question for you. It also would take a lot of pressure off of the team. That 4 to 5 day window is pretty tight.
Let's answer that question, so as we go. Okay. I have no problem with that. I think that there's wisdom in that, actually, because then we're getting, the data is only as good as the insight that comes with it. So we can take anything. So I think that's a very fair.
Okay, great. Generally we're good. And then the second question is in terms of efficient use of your time and resources. We were kind of thinking these are quarterly, it's a lot of data, maybe that we would put them on consent the first quarter and the third quarter, and that we would have them as not an action, but an item on the regular agenda on mid-year and year end. So that it's a good balance of you're still getting the information quarterly, it's transparent to the public quarterly, but we're only really talking about it mid-year and year end. I see some nodding on that as well. Okay, great.
And for my part, I want to make sure that your staff understands that it is not my intention to micromanage members. We want good data. We want good analytics, I think, as a body. And I don't think it's really my place to tell you how many days you have to turn it around or when it would appear on an agenda. The chair can certainly work to that as he deems fit. But I just feel very much in the policy lane for a body rather than the telling you exactly what to do each day as you go about your duties. I trust the staff. They're doing good work. And I think perhaps maybe we're having a little bit of like COVID fatigue after the fact, where we were making everything so quickly decisions, that I think that I would just like us to take a little breather from my perspective and try to do best for policy outcomes. That's sort of my take. And it may be relevant to a lot of things you discussed today. I appreciate that you and the staff and Ms. Olson really want our buy-in, and we're all willing to give it. But I also think that none of us want to be in the position of really telling you exactly that you've got to do something on certain dates, for what it's worth.
Appreciated. I think that part of the reason we're spending some time on this agenda item is from the governance lens. You are also kind of the keepers of making sure that we're transparent to our public. And so the vehicle for sharing this information with the public is also the DBOH meeting. So as long as you're comfortable that timely is still within 2 months, I think that we're in good shape. And we appreciate not being micromanaged.
And I'd add that as you guys do decide what best how that works, it's just timely and consistent. Because that does help, not just us, but it does help the public, where they're not wondering when, like, you give one report 5 months, the next one 6. You know, it's random. Being non-random helps keep things accountable, keeps us informed, and it helps us pay attention to it. But I agree with you very much that we're not.
Excellent.
We really want to hear from you guys what's working.
Excellent feedback. Consistency, we will do that. Okay. So those are the ones that we've been doing, you're familiar with. So now we're very excited to share a work product that has been a lot of work from the folks sitting at this table, also their supervisors and direct reports who spent a lot of time and energy pulling this together. So one of the things that we've been spending some time talking about is key performance indicators. And so you now get a report that has literally hundreds of indicators, which is, you know, wonderful information and transparent information. It's also a lot of information. And so we had gone through a key performance indicator exercise with our team of, could we look through the performance management indicators that we've collected, and are there a handful that we could roll up as a that we could bring up or elevate as key performance indicators? And the truth of the matter is that the health district has almost 30 programs. And if you just pick a handful of indicators, what ended up happening is some programs feel more important than other programs, and that really didn't work for us. So instead, we went through an exercise in our last performance management update process coming out of the strategic plan of looking at where are there similarities across divisions, where if we ask the question just a little bit differently and aligned how we're asking the question in air quality management and EHS as an example, could we then have data that could be rolled up that was a little bit more apples to apples so that we could see the volume and impact of our work rolled up into bigger categories. And so that is the way we went instead. And so we are very excited to share this new district snapshot. Now, I want to direct you to this document because this is important. This is the data that is underneath each of these rolled up numbers. And so the exercise we went through with our staff was how much could we get for 3 years? So going back 3 years, so we wouldn't have to wait to collect it for 3 years to be able to show trends, what could they pull together? And we've had conversations before that we have different business systems in different divisions. Some of those are more user-friendly than others. So the staff made a good faith effort of what could we get going 3 years back. And anywhere that there's the orange, we just weren't able to get it. And then we could only roll up a number if every indicator was able to be in that year. So in this first iteration, we have a lot of 1 year data. We have a little bit of 2 year data. There are some performance indicators that we know we will be able to report in 24 that we're just not able to report because every single indicator was not able to be there. But we'd like to share with you the results of that work in our new district snapshot. So it's a storytelling tool. It rolls up those similar data points. It has both workload indicators, so volume indicators, and performance indicators, so how are we doing? Our frequency that we're thinking based on the workload right now is annually. That could be perhaps change in the future, but really some of these things, until you get the annual number, they're not very meaningful. Our intended audience is, of course, you, some of our stakeholder groups, and the general public, knowing that the public's probably not going to read through our 25, 30-page quarterly performance management reports, but they might look at a 3-page snapshot. So, Erica, did you want to add anything at this point?
You know what? Another audience would be the staff overall as well, and I should have pointed that out. So,
So we're going to roll into the first page of it. All right. So the story that we're trying to tell is the impact of public health and how, as a public health agency, we provide many layers of protection to protect and improve the health of our public. And so on the first one, I'm going to turn it over to Lisa Lotritz to talk about our number of clients served.
So clients served directly. Northern Nevada Public Health does serve a layer of protection for our community in that we, those clients that do not have other options for care in our community, we try to cover that. So some examples of that would be immunizations. We have 317 and vaccines for children for our population that does not have insurance or they're underinsured. So we do that here. In family planning, sexual health, if someone doesn't have insurance or they do and it doesn't cover those services, we have a sliding fee scale where based on their income, they can slide to zero and not pay anything for their visit. In TB, that one is mainly covering our clients with active disease and ensuring that we're keeping our public safe from TB. Chronic disease injury prevention, I can go on and on, but for clients served, it's the making sure the gaps in our community are covered the best we can. And so looking at the last 3 years, in fiscal year 2021, you'll see that we're at 179,000 clients served. And that was the beginning of COVID vaccinations. And it is like was said for staff, this looking at this saying, yeah, we were really busy. So this does show all the hard work that we did put in to COVID vaccines. The next year, fiscal year 2022, we are still pretty high. That was mainly COVID boosters, but getting somewhat back to normal. And then fiscal year 2023, that's more what we're used to seeing, about 20,000 clients per year.
And this does include some duplicated clients. So there is no way for us to pull out of our system a single human being. So if they've had care from different programs or multiple times for one program, this would include duplicated clients.
Sorry, I'm going to add one quick thing. I think it's obvious, but just to state it. So this is year ending, fiscal year ending, what we're looking at. So the big numbers are ending, June 30, 2023.
And this one, because there's so many programs doing so many different things, there is not a performance indicator that we can roll up. All right, going to move on to disease case investigation. Nancy.
So another layer of protection that we do for our community is that we have our communicable disease investigations. This is split. EPHP does a chunk of the communicable disease investigations. CCHS has sexual health that they deal with. And our teams make tremendous efforts in trying to make sure that we prevent further spread of the communicable diseases in our community and help connect our citizens to education and for resources as needed. So in here, not including the big chunks of COVID and flu respiratory diseases, we have led over 7,700 disease investigations in fiscal year 23. The different diseases vary depending on year, whether it's going up or down in terms of investigation case numbers that gets reported. Mostly we're seeing an increase in the majority of diseases, but gonorrhea did decrease between fiscal year 22 and 23. So overall, we're not seeing too huge of a change in terms of a number of diseases investigated from fiscal year 22 and 23.
Fantastic. And then on this one, we do have a performance management indicator. So it's one of the important things about disease investigation is that it happens in a timely manner. Probably most Americans now know more about case contact tracing and disease investigation and why it's important, but timeliness is really important. And so our target, if you rolled up all of it, was 92% were initiated or completed, depends on the disease, it's a little bit different. within the recommended timeframe, usually set by CDC, and we hit 92% in this last fiscal year. So good performance indicator there. And that is the one example that we have of a performance indicator that we're able to roll up for all of them, but that's where we're headed. Question?
Yeah, last year we had a national group give some feedback on this, and we finished #1 in one category in the nation. We're doing better in that category.
So are you talking about STIs specifically?
Yeah, syphilis, yeah.
Lisa?
To that, unfortunately, no, that is still a concern in our community, and we're working every day to try. And it's national, ammunition issue nationally, but
No, I understand.
but we are.
Well, we should be bad. We're #1.
We're #1.
One question for Nancy on this. So, though it looks like we stayed flat, our population has increased quite a bit a year. And so with that said, I'm not saying you need to change anything, but it is kind of pretty important to realize that potentially some of the work we're doing is lowering the percentage of people with, am I correct in saying so, based on this number? If the population went up, we actually didn't see an increase, and that would tell me that some of the work we're doing is helping, because it should be, you should have more just based on numbers.
In terms of workload, if I'm speaking to that, it really depends on disease, right? Some of the disease, it could take us weeks of follow-up to deal with one disease or even one person. So depending on which type of disease, some diseases are a little quicker. It might be resolved, in a week, we followed up, or a couple of days, we gave them information, that's it. But some takes a tremendous amount of effort that takes more than just one person to make sure that we are dealing with contacts and we're dealing with properly. So it's really hard to speak to workflow based on just the number, because it really depends on the type of disease we're getting. And because we have over 80 diseases that we're investigating, so this is kind of everything mixed together. But I do understand your point where you're saying that if we're split by population, there is a population increase usually, yes.
I'm not even saying workload, because I get what you're saying on that, and I don't even presume to understand fully workload on that. But I am saying, as an attaboy, almost in a sense, we've actually seen, in terms of this, you've seen a decrease last year in this based upon population mix, if we did a percentage, and that is good, because we do a lot of work of trying to prevent. So am I right that our prevention is
I think your insight is right, that the population is growing and the number of disease investigations are going down.
Yeah.
I think where we may be a little uncomfortable is doing a causation or correlation to the work that we're actually doing is driving that, because with 80 different diseases, it's a little hard to say that we're bringing down flu. Maybe flu is not a great example, but that we're having to do less disease investigations because there's so many things that affect those 80 different diseases and how much disease we have in our community. So we'll take the attaboy, but we're probably not going to be comfortable with causation or correlation to our work. But incredibly important that I think the community, the nation has learned, incredibly important that we're in this space and that we're doing it in a timely way. All right.
Is there any way to measure the tourist amounts? We have about 1 million tourists a year coming in. Obviously, those are helping to spread some of these diseases. And Vegas 10 times as much as that, about 50 million a year. I mean, so Nevada always looks bad in those categories. Is there anybody really getting that type of data? Is there a way to get that type of data?
So I will look to Nancy and Lisa. I'm going to make a general statement because I think we've talked about this a little bit before, that generally the way we work with CDC and nationally is that the cases get sorted into the county where the person lives.
Yes.
As opposed to, so the numbers that you're seeing don't show that. So do we then have data that can talk about tourist impact or tourism impact in terms of spread? I mean, we have insights from our case tracking. And when do we do contact tracking, that the folks who are on the ground are knowing, is it in a pod in our community, or is it something that we're seeing a spread from somebody went to a wedding someplace else, kinds of things. But data that's actually something we could point to. Let's see. Okay. All right, we're going to move over to inspections, and I've forgotten who's kicking it off. Thank you, Francisco.
Yeah.
Thanks, Julia. And you can include me in the audience for this data snapshot. I knew Northern Nevada Public Health did a lot, but these numbers are super impressive. So include me in that audience. And just continuing the kind of layers of protection kind of theme that we've got going on. The number of inspections that we conduct here in the community is super impressive. And I think what you're taking away from this is that we are not just here in the office, but we are actually out in the community making sure that businesses are, complying with the requirements and the regulations, but also providing that outreach, education, and compliance assistance as well. So on the air quality side, just some highlights here. We're out in the field doing dust control inspections, making sure that developers are using best practices in controlling dust. We get a number of complaints, from residences saying, we're being impacted by dust. So again, we're going to follow up on those. We're inspecting asbestos renovation and demolition projects. Again, there's a significant risk associated with asbestos pollution. So again, we're at those projects, making sure that, again, best practices are being followed, and again, providing that compliance assistance. On the EHS side, we're doing waste management inspections, where again, we're following up on making sure best practices for collection and disposal are being followed. This is especially true at the kind of transfer stations and main waste management processes. Also underground storage tanks. And again, I want to make sure I read this so I get it correctly. They're inspected on a biannual basis, and this includes reviewing kind of testing that's going on, any maintenance and monitoring as well that takes place with those underground storage tanks. So again, critical aspect to make sure that our groundwater is not being. Last one is the food establishments. And again, inspecting those facilities to make sure that current food safety regulation and practices are being followed. In regards to the numbers, again, almost 10,000 inspections on an annual basis is a lot, especially considering the resources that goes into conducting all those inspections. We did see a little bit of a drop in fiscal year 2023. I know on the air quality side, some of that can be attributed to kind of a drop in the real estate market where, for example, our dust control, our development, and then our asbestos projects are kind of tied to the real estate market. So we kind of did see a drop there. We also did see a significant drop in the number of food establishment inspections. So that's kind of what kind of led to that smaller number in fiscal year 23. But again, tremendous amount of service, and again, really shows that we are out in the community.
One thought that I have, and maybe it's not in this, I don't know, but just your full-time staff equivalent on the would give us
next presentation.
Oh, then I will wait.
I appreciate being oriented to the district snapshot, and I really love the performance indicator and the second example that you gave, and that's really, really helpful. I see the year-over-year comparison. You have the differences in percentages illustrated, and to your last statement, is this created in-house? That's my first question.
So, okay.
Off of that, yeah, but
which comes out of performance management. Created by On Strategy this year, and then we'll learn to do it.
The reason I was asking is because if you're using a certain program, certain options aren't available depending on the program you're using. But the institutional knowledge in this room for folks that have had careers in this field, and it doesn't always translate to just a 3-year snapshot. And I was wondering if there was a potential to even drop like a small yellow line that showed like a 10-year average. And if we look at the first box, the 20,000 being new, I don't know that 179,000, and I may not make that correlation that was COVID related, and that's a outlier, that's not the norm. But I was just curious to see if you considered that. I'm not saying you have to, but for those of us that don't have that institutional knowledge of the trends of where we've been and where we're going, or what's kind of normal, what's not normal, is there more than a 3-year kind of baseline that we've considered adding as a visual representation?
I think technology-wise, easy. Data-wise, and just to comment on
the analysis of that.
Yeah. Well, and even just to it was interesting coming in and thinking about this. So this, on its face value, and I know we all know this, looks super easy. what is so intense about the work to put this together is not the data visualization, but the data integrity. And while we're awash with data as an organization and as organizations, the actual ability to pull it together in a harmonious, comprehensive, multi-year way across 30 programs, I'm actually kind of shocked we even were able to do this. I totally, I didn't actually think we would be able to do this at all. And we didn't really know when we started. So that's just from an external perspective in terms of what it's really taking to even get 3 years. So I'll say that, not that I'm not with you. I think there's also context that can be provided external from just the multi-year trends. But Jilly, I know you can add on to that.
Well, and this first exercise, we wanted to do 3 years back, right? And we've had conversations about getting information out of Excel as an example, or getting information out of Patagonia. Like, our systems are our systems, and there's work to make those systems better, and they get better every year. We can do reports. So on a go forward, so on this one, you're going to see the performance indicator would be the percentage of inspections that get completed. For us, many of these are mandates. They're required to be done. You as the board need to know, the community should know that we are getting them done. It should always be 100%. Sometimes it isn't. We couldn't get that even for the last fiscal year, for every indicator to be able to roll it up. So we are keeping very high data. So we will have 10 years of data when we've collected this data for 10 years.
Exactly.
If that makes sense?
Yes.
So it's not that we don't want to. We'll have the first year of performance data at the end of this fiscal year, because now we know that we can set up that report and pull it in Excel, but we couldn't go back. We could, but the amount of labor that it would take was not appropriate for the juice wasn't worth the squeeze.
Understood. And I appreciate the reminder.
So it's the goal.
Yeah,
right?
And the collapsing of all of these metrics into one, dashboard it's very comprehensive and it's difficult to do. So I appreciate that explanation. I guess just in the presentation for me as a board member, the historical context would be helpful. If we see large spikes or moments where this isn't the norm as a newish board member, that context.
And we do see this as a tool for storytelling. So the district health officer could be at a chamber meeting and could be using this, and there'd be a script that would go along with it, a slide deck that would go along with it. We're just showing you the standalone snapshot at this point.
I think it's great.
I'd like to add to that just one thing. I do think, even if it's a general of something on some of these, a pre-COVID understanding would be helpful. Mm-hmm. So even if it's not a 10-year thing, because it is, I mean, in my mind, I can think back because I've been sitting here watching, but the truth is, I still don't remember numbers. I'm trusting that, but if you even had some pre-COVID, this is a little bit more average, even if it was not as integrous. And I say that we always don't want false numbers, but there's a way to get some general numbers. That might be helpful to just something to look back and say, this is a little bit more of our normal, because we've had such a strange couple of years that just it took so long to get out of that. It might help. So that might be
Agreed. I mean, I think we're building institutional capacity, and I think we are all wrapped around the axle on COVID, and will be. I don't know how long as our agency we're going to be. If we were doing 3 years, COVID will fall off in the next iteration, right? It is such an outlier from a data perspective. And if you look at clients directly served is really the only one where COVID is impacting. If you look at disease investigations where it's really only a 2-year, you don't see the impact there anymore. So we're trying even internally not to let that very outlier of a thing drive everything that we do, because it is such an outlier. But context is important, and we hear what you're saying. Okay. All right, so plan and building reviews. Oh, sorry. So I think we touched on this. No performance measure because we couldn't get it for every single data point. It'll show up on the data dashboard at the end of this.
Mm-hmm. So for plan and building reviews, so these are the number of building submittals we had, plans submitted. The amount of reviews conducted is actually higher. If you look at the board report, I started breaking it out for you so you guys kind of see, like, one submittal is not equal 1-to-1 in terms of review. Our fiscal group may review some stuff. Our food plan review team may, our engineering team, all these different almost sub-permits is the best way of putting it. So that kind of shows the submittals we've had over the years. And the best way of looking at this is you've heard the saying that ounce of prevention is worth a pound of cure. So ideally, building plans and submittals they're kind of our first layer of protection to make sure that our community and the applicants are prepared for success, make sure there's no disease spread or that any infrastructure issues arise that may contribute to that. And so you can kind of see with some of the data, building plans and reviews, submittals have been increasing over the years. And then it's been fairly flat. That's between last fiscal year and this.
And then same thing on the performance management here. We couldn't get so it's a customer service performance indicator of the time it takes us to turn it around, which the jurisdictions obviously care quite a bit about, as well as the stakeholders in the community. Couldn't get it for every single indicator, so you'll see it at the end of this week.
I ask what, I assume that all the jurisdictions have different timeframes that they would like to turn it down by, or are they consistent?
It's a consistent jurisdictional standard. So
what is the standard?
I believe it's 10 business days.
So you feel confident that we are meeting that correct? I mean, it's not measured here, but
you can see some of the raw data in the background, and I'll give you where we're sitting. And so I'm going to do page 2. Section 8.
Number 8.
This topic came up in our most recent City of Reno housing workshop. It's really a topic focused on intergovernmental cooperation. And we brought in a national expert from UCLA Policy Center to help us chart a path for the things that we reasonably do in the housing space. And one of the topics was interjurisdictional cooperation. So I just want you to be aware, and certainly my colleagues at the City of Sparks and Washington County, that one of the things that we're going to be trying to initiate is some cross-governmental collaboration in that space so that we can all make sure that, I think they have done that historically in the past, but we're going to sort of try and see what we can do to take it to the next level. And I don't know that it's a real specific and targeted thing that works with the Northern Nevada Public Health Board. It's really talking about TUMWA, NDP, us. There are so many components to it. And it's one of those things that cyclically we get complaints about. So a developer, whoever developer A is, will complain about the one who they're in the mix with. Right? It's not that they're saying that all government entities are slow and creating problems, but it just happens to be that when they're under the pressure for one agency, they pick on that agency. And so in the last, I would say several months, and maybe since I've been on the board, I have had constituents raise those issues with me that then I have to raise to, and in this case, it would be raised to the district health officer, and we've worked through them. But it's been everything from EHS, it's been pools. I had a recent one that you helped me navigate that was really important about pools. And so, again, because the 8 different jurisdictions are all trying very hard to make sure that we are meeting the customer service oriented demand that it creates, I want to make sure that you know that this will be a focus from the City of Reno, and I think the other agencies are likely to come along. And I don't know if this will be something that when we get to the budget and we're reflecting on that as we roll it out next year, that you'll be telling me that, hey, we need more people. If you want us to be more timely with our plan checks review, that's a policy choice for us to make. So these are good things for us to consider. And so I just put it out there because I think we're probably doing a good job. I don't know that we're perfect. And again, I think the complainants, we'll call them that group of people who complain, are really only complaining about the agency that is holding them up at that time.
So excellent feedback. Thank you, Councilman. I think if you go to this page, it's 8. They're all numbered on the side, so we're looking at 8, just to make sure you're fully seeing. And so for this one, and again, issues with Excella, how much time it would take. For air quality management, percentage of plans reviewed for compliance with air quality management completed within jurisdictional timeframes. That's in orange because we weren't able to get that out of the system. We will be able to get out. The target is 90%. Then if you look at residential septic and well plans reviewed, target's 90%. We had 93 in the last year. And then if you look at percentage of commercial plans reviewed for health standards, that has gone down. The idea here is that now we see that number from a management and leadership standpoint. That's data that director can go back and say, okay, what is happening in this division? Staff turnover. There's lots of reasons for these things. But then you would be able to go back to the stakeholders and say, our target is to hit it 90% of the time. we are currently hitting it this percentage of the time. Yours is an outlier. We're going to work with management leadership to figure it out. I think the thing that may be unusual is that we've been now collecting some of this data in our performance management system for a couple of years. As you are leading that effort regionally, I think it would be wonderful if we could get to that kind of management of data from all the jurisdictions so that there's this bigger picture of, you know, where is it really getting slowed down or what's happening.
Do that though, everyone would have to use the same Acela.
I will say what Erica said, it was a big lift. And so I think each agency would have to go through their own process to figure out what they could measure and what is most valuable to the whole. But we are very committed to giving you very transparent data about the performance indicator and to the community as well.
Well, and as much as Chair Dare talked about the data person, you know, rules, this number is not good.
Right.
I think this is not anything that we want to be excited about, but it also tells me that you cannot change what you can't measure.
Right.
And so having the data tells us there's our gap, there's our hole, and how we're going to go out and create systems we want to make that happen.
Yep, exactly.
Perfect.
Management leadership tool and a transparency tool.
So 2 questions on that too. Wouldn't that 90% on here, I know that's a goal that you guys put, but that's also potentially policy where we can say, well, we want to be at 95%. If we want to be there, then we do have to reduce our budget. Something of that sort. I do have a question for Joelle. We just had a big conversation in the city. AB 231 passed. I think that's the bill, and it actually is going to tweak some of our timing on. And our city's kind of reeling a little bit, trying to figure out how to adapt to that. Are you aware of some of? I don't know.
What's the content of the bill? Not just
the content of the bill is the timing of when things come in, how quickly it needs to be done, and even if the information's incomplete in the past, we were able to push it off. But now the state law shifted, and so it's going to create some waves of requiring us as a region to have some ad hoc meetings instead of our monthly scheduled meetings. It's going to be a pain in the butt, what's going to be. And so we fought against this from what I heard, but lost and it passed. So I think it's AB 231. It might be something in the future to think about. Yeah. Not waste time today, but I can say it is what I agree as a region, we have to be looking at this, especially because when state stuff starts coming at us, when it starts affecting, I don't know how it'll affect our health board, but I know that we have staff. I had a long meeting yesterday, the concerns of that bill.
Okay.
So residential zoning.
Okay.
Residential zoning for land use planning.
So I suspect that we're not prepared to comment on that particular legislation live today. But speaking more globally, definitely those are the kinds of trends that could show up in data, that could change what the jurisdictional time frame is, that could change what our performance management standards were, because the environment affects all of this. Okay. Want to keep us moving? Are we good to? Okay, great. So we're going to move on to permits, registrations, and notifications managed.
Just really quickly, Councilman Reese, I just wanted to communicate. I have also been a part of some recent conversations with community organizations where I got similar feedback. And I'll just say that we look forward to working together and hopefully coming up with maybe a streamlined approach and how we can improve on some of these processes. So.
Well, to be clear, no one I think is, I don't think anyone has spoken ill of that of public health. They know that you all are working with the resources this board has given. I think they just, when they have the issues, you are the target or brunt of the criticism. And then it moves on, you solve it, and then they're mad at Tumwa next week. It's not anything that you all have done. I just think that we have to be honest with ourselves. If we have not given you the tools to be successful, that's on this bot. It is not on your staff. And so, again, part of the conversation going on in these groups, whether you go out and meet with the AGC or the bill, is that, you know, everyone's pushing for things like, you know, electronic plan reviews and submittals. And I think that's mostly largely happening. And they're talking about, you know, are there one planner assigned to a thing? multiple people who have their hand in it. And again, there are solutions, but it's really just going to take us working together to figure those out. And better that we are all together and doing it together than each individual agency. And for most of us, we serve on multiple of these bodies, right? Because, you know, the chair is also a chair over Tumble, for example, another place where the bottleneck happened. Commissioner Garcia, of course, leading some of these conversations inside the county. We all know that we have some obligations to make the processing part of this better, because those processing delays are dollars to projects, which create unaffordability. And will it solve affordability? No, but it's one element to it. So the work you're doing is important, well thought.
Very well said. Thank you. Sorry. So permits, another area where, again, the kind of numbers kind of speak for itself, but we issue a ton of permits, registrations, and notifications. And I think some of these programs, the level of the permit kind of aligns with the risk as well. So for example, for us here in air quality, the wood-burning device registrations is exactly that. It's registration and information for us to make sure that we're managing the resource appropriately. With our stationary sources, those are far more complex, and you can see the smaller number of them. I did want to mention on the waste management, I thought this was pretty interesting. This is on our website, but along with the permitting, we also provide public education campaigns for waste reduction, reuse, and recycling, and the purchase of environmental friendly products. So I thought that was kind of important to communicate with you. The goals associated with some of these permits registrations is kind of twofold. First of all, it's another layer of protection as far as we are being able to evaluate these sources and making sure that they are constructed or being implemented in a manner that is protected. So we go through this review process and make sure, again, those regulatory requirements are being followed. The other part of this is it's our way of communicating compliance kind of expectations for the business and industry as well. In addition, communicating to the public that this process and this business has been reviewed. And in general, if it is operated in compliance with the permit, it is protective of public health. So it's another tool, again, for us to use as far as compliance assistance and things like that. So a lot of good community service there. As far as the numbers go, as I mentioned with inspections, a lot of this is driven actually with our wood burning device program, which is tied to, again, real estate and development. And you can see with fiscal year 23, we had almost 3,000 number drop in the number of wood burning device registrations that we processed. So that's why you kind of see that reduction in the number there.
And again, not really a performance management indicator. This is we're required to do it. We issue these permits. There's not a real customer service or performance percentage indicator. Just good to know that it's a lot of volume, a lot of things that need to be moved. All right, we'll move on to vital records and requests.
So we serve our community through vital records, request services, and then we are the reservoir of all the birth and death that occurred in Washoe County. And our vital statistic data also provides valuable statistic data that we use for our population as well. And in fiscal year 23, we issued over 41,000 birth and death certificates. We registered over 11,000 of those, and we made corrections to almost 1,000 for a total of 54,000 requests fulfilled. So vital statistic requests has been ongoing and then in the upward trend as always year to year, just as we expected because population increases. But as you see for fiscal year 22, that number has seen more uptick more than usual. And that's because in kind of the end of 2021 and the first half of 2022, we've seen more death and birth being recorded. So that's due to a variety of reasons. COVID could be one of them. But I don't want to say that for sure.
Can't make correlations. I mean,
no causation correlation.
No correlation.
All right. And again, not a performance management there. We do a lot. All right. And then public records request, Bill.
So for public records requests, we're always committed to being, the proper disclosure, transparency. And so a lot of the public records that we hold in EHS is there's some property records, septics and wells that people are interested in. So we want to provide those in a timely manner so that any issues or proper planning can be remediated. And then we also have other records that are geared more towards kind of, development, phase 1 assessments. So you have your USTs, your solid waste management, essentially developers or builders doing their due diligence. So, and you can kind of see that the data requests have been kind of coming up over the years. So more and more data is being requested from the health district.
Okay. And again, same thing. We're required by law to do them in a certain time frame. This is more of a volume indicator for you. All right, so just to pause there, there's 2 more pages. We're not going to spend this much time on the next 2 pages. Just wanted to give you a sense of the work that we're doing. This is really the programmatic focused one. I will just say that as staff, we had a moment when we saw this for the first time because the volume just makes you pause a little bit to say, wow, we know we do this work, but even for our own cross education across divisions and things like that, to see it all in one place. This does not represent all the work in the health district. So it's kind of a key performance indicator methodology. There's lots of other things that we do, but these were the things that could be rolled up, could be combined, could be brought forward to be representative of the work that the health district does, but not inclusive of everything. Any questions on this one or comments? Giving us lots of feedback along the way. Generally, like it. We should continue to pursue.
It's impressive, the gathering and the synthesis of this, having so many different departments. Just looking at the diseases just in the first box, the number of diseases that we're tracking, but you've collapsed it all into one chart. And I think having this document side by side as I was looking at this for the first time was really helpful, because my question, I was a little unclear to Councilmember Reese's point about maybe it's just the language, the way that the planning and building reviews box is labeled. I was really unclear because I leaned over and I said, is this just air, septic, and commercial? And Aaron was kind enough to say, no, this is just all commercial. And so that one just felt a little like the percentage of plan and building reviews. And you mentioned jurisdictional, but my brain went so many different ways when you bring in the word jurisdictional. I was like, what aspect of multi-jurisdictions are we talking about? Having that word commercial really was helpful.
Okay. And maybe just to add, that's great. And maybe also just to add a comment to the place that we want to, the immediate brain wants to go to is against what? Against a number of FTEs, like you said, Chair, or other such things, to turn it into a bit of more of a, how effective are we at delivering this volume of work? And I'd like to just comment on the fact that when we started this project process, we were not so appreciative of workload indicators. And as indicated here, as we can see, they're pretty powerful set of information just to see the volume. I think as we mature in the data and the data clarity that we have and the data consistency we have, we'll be able to continue to add and make these more contextual in terms of effectiveness, not just a comment on that.
All right, we're going to move to the next one, which is more about community engagement. So that is something that this board has been pretty consistent with giving and support for making sure that we are working with our community, that we're out in the community, that we're doing significant community engagement. And that happens in 2 ways, right? It happens in the communications space with the work that gets done there. It also happens with our community outreach partnerships and those kinds of things. So I'm going to turn it over to Scott to relatively quickly go through the communications pieces. They're pretty straightforward. And then I'll spend a little bit of time on the partnership piece.
Thank you, Julia. The comms team is really good at speeding up presentations. Good here. Going to talk about 3 of our main components in communications. A lot of people know social media, our website, and the work that we do with the media and public information are our 3 main components. The first 2 squares up there and the one right below are involved with social media. And we're tracking here is just to show you kind of the raw number of posts and followers posts aren't always a good KPI, but we wanted to show these because you have to get your message out there. There's a lot of different influences and a lot of things that we're competing with. So we wanted to show just the total amount of some of our social media posts and the growth and why it's important. So when we started, so pre-COVID, we had about 1,300 followers, and that was just on Facebook and Twitter. So what we've made a big emphasis on growing the number of followers to get more of our reach numbers out there. A couple of ways we've done that is through Instagram. We've only had Instagram actually for 1.5 years. We're a little behind, but we didn't want to create just a social media platform or profile account just to do it. We wanted to be strategic about it. And I think we've done a pretty good job there. We have over 600 followers just in 1.5 years of being open. We also created our Facebook in Espanol account, which is specifically in Spanish. All the posts are in Spanish. We've had some really good growth and engagement in that platform. And then we also added LinkedIn just this year. We're trying to grow from more of a professional development and careers standpoint. The numbers in engagement growth, you see a huge number there, 496%. That's all me, I did all, no, I'm just kidding. So COVID-19 obviously put us on the map, especially here in Washoe County. So we saw some unbelievable social media metrics throughout that time. FY21, we saw a huge increase. FY20 was also a huge increase. We did go down in FY22, which was expected, but I was very proud to see the 125% growth in FY23. We're continuing to post more. We're getting engagement and help and participation from our staff throughout all of our departments and divisions and programs. So we hope to continue to see those numbers grow. The one in the top right corner is website clicks. Again, those are a good measurement to see how many people are engaging in our pages. Again, all me, 2.1 million, just kidding. So COVID-19, we saw unbelievable page views. Our site never broke, thankfully, but those are the type of numbers that you really get once in a generation. That doesn't include our COVID-19washoe.com site. This is just what was washoecounty.gov/help, not an NPH.org. But we saw huge numbers, so you can add another 3 million just from the COVID-19washoe.com site. So obviously we expected those numbers to go down. So FY23, we have 479,000. That's where we want to be. Pre-COVID, we were anywhere from about 350 to 425,000 page views a year. So we want to see that stick around the 500,000 mark, I think is where we need to be. The whole goal like we said, website clicks are not exactly where we want to be. We want to be able to help people find the information they want as fast as possible. We also want to keep people from calling us if they can't find the information on the website. So we're trying all different types of things. We have a brand new website. We're working on navigation. Now having that new website, NPH.org, is a lot easier for people to search for information. If they search our site, it's just health district related material. In the past, when we were part of the county's website, it was every single program and department in Washoe County in terms of the search results when people did search for that. The last one is press releases, media alerts, media availability, public information. So again, we sent over 525 press releases during COVID-19, just COVID-19 related. We had 160 media briefings during that period that were just COVID-19. So that's why those numbers are really high in FY21. Ideally, we want to come back into that 127, 125 range as we're moving forward. We averaged about 50 to 75 press releases per year pre-COVID-19. That wasn't necessarily a great thing. We want to get our programs out there. One thing we're doing, instead of just sending press releases, we are having media availabilities. That's for both English media and Spanish media. We're trying to make it easy. That's the purpose of my job, is to make our information and our services and our information easily accessible for media, for the members of the general public. If we can create those media opportunities where we say, hey, we have our district health officer, we have our board chair, going to be at this place at 10 o'clock tomorrow, come on down. They don't have to do anything. They just have to show up and get their story. So we try to make it as easy as possible. There's a couple other things on here, but I want to say before, you're seeing a lot of really good success measures, and it couldn't have been done without the support that we've gotten from our board, from the organization. You know, we started in 2019 with one person on comms. In November, 2 years ago, we brought in our media and communication specialist, Yara Diavola, who has done tremendous work, not just for the health district and NMPH in general, but for our Hispanic community. Our outreach to the Hispanic community has never, ever been this good. So that's a big help. And we also just hired a support specialist on Monday to kind of continue those efforts, to continue the growth. And part of that growth is working with our, not only just our staff, but also our community outreach personnel within NMPH. Having community health workers in this organization really transcends communications in general for community. When we're able to not only send the information, but have people go out into the community and be the eyes and ears and talk to those people one-on-one, it creates such a great symbiotic relationship with that community. So we've really made some great strides there that I will pass along to David.
Thank you. And just to emphasize here, obviously media relations, public information important for any agency, but we're in public health, which includes public health education. And so getting good health information out is a programmatic function as much as it is a communication and public affairs function. The middle one is we are working with Truckee Meadows Tomorrow, which is a nonprofit I think you're all familiar with, to create a data portal on their site that is inspired by our CHA, so that our CHA doesn't just become this every 3 years paper document, but has a dynamic front and is hosted by an outside agency where people go to get good data. So we'll have that. It's being worked on. It'll show up in 2024, and we want to track how well it's doing if people are actually going to look there. Want to talk community outreach. Scott already alluded to. We've got the community health workers. We also have the community organizers. I think Chair Dare, you've commented recently about seeing us out and about more. A lot of that is due to those staffing investments and our ability to do that. But that's not it. If you go into the roll-up data, you can see that community outreach is done by every division. And so that we do have staff out for different things. This is tabling, presentations to community groups, it's an instant of any of those things, those kinds of things. So
it's been very noticeable.
It's been very noticeable.
Since last year, they have to. Last year, it's been very
fantastic. And then partnerships is not just an instance of community outreach, but an actual ongoing partnership where we're working with another agency or agencies on an initiative. And so you see a lot of that out of our community health improvement plan. You see it out of our EMS division that does a lot of partnerships. And really every division also has partnerships where they're working, which again has been important to this board, that we are working collaboratively with our community members. So there's 78 partnerships there. And then Nancy, I'll just turn it over to you quickly for communicable disease reports.
Yes, and just to echo what Scott and Julia just said, that education is a key prevention. And then when we have accurate data that we can show the public, then that's really what helps stop the spread of misinformation. So we provide education, situational snapshots, and information dissemination to our community and to our providers through a variety of reports. This includes our IP news, our quarterly reports in carbon producing organisms, our weekly flu reports during the flu season, our annual disease reports, just to name a few. We have quite a number of reports. And we've been consistent, as you see, in increasing our epidemiology reports in the past 3 years. It pretty much doubled from fiscal year 21 to fiscal year 23. And this is due to, in fiscal year 21, that is the start of the COVID year, where we try to use our workforce to focus on disease investigation, mitigation strategies, and we essentially only put out reports that's health alert network publications, essential ones that we immediately need for major situation awareness. But we didn't really have the capacity to divert our energy on all the reports while still dealing with mitigation of COVID. And then coming out that year, we built back our normal capacity slowly. And then in the recent year, we also just added more reports to our Epi News to utilize that communication channel to educate our target audiences, and also adding our quarterly disease-specific snapshot, which I talked about during some of our board reports, and then monthly COVID reports are now added, and we're able to catch up on our community antivirogram for several years. So that's why you're seeing this upload.
So community engagement and communications.
Can I just ask, Scott, I know that we have done an awesome job at reaching out to our Spanish-speaking population and make an assumption that there are other populations and other languages that might be appropriate. Either today they're appropriate just based on volume or number of people, or that we know that they will be. So what are our opportunities in terms of communicating with people in their language, and it is not either English or Spanish?
I think, luckily with the new website, we have a better opportunity to translate our information. Again, it's not going to be a perfect one-to-one translation, especially for Tagalog and
that's really the one I was thinking most top of mind.
I think that's always something we're keeping in the back of our minds in terms of improvement, because we don't have a lot of direct communication to that in that language outside of our website. But I think as an organization, we're taking a look at all kinds of different data points that we can have, not only just giving information, but like what is the information they want. So I think some of that data collection is still ongoing, and we need to get to a point where we can better understand the need, and then we can, I think as a community, not just us, I think we're all kind of working on ways that we can better communicate to people with different languages other than English and Spanish.
And I'd like to just quickly build on that within my team, which is the health equity team. We are jumpstarting the language access planning process. The county is also doing a language access planning process, and we are a significant partner with the county's team to do that, so that we can do that work comprehensively, but we're kind of jumpstarting on best practices. We have some extra resources right now to do some translating, and so all of the division directors have been given a sort of a tip sheet. They've been given the data in terms of what percentage of our population speaks what languages. And so they're going through a priority process now for all of our forms, documents that are regularly touched by the public. And then we have some resources to be able to outsource that translation, so we can make a big jump forward over the next couple of months on things that people are touching in a number of different languages.
What are our top 5 languages?
Oh, I'm not gonna be able to do it off the top of my head. I apologize.
What is the next one after English or Spanish that you think?
I don't know the answer to the question off the top of my head. I apologize.
But just to add on to that, the work that the county is doing is GIS mapped, and there's quite a bit going on with that, which will be forthcoming.
Yeah, it doesn't surprise me that they're way ahead.
We know it.
I was just going to add that there's increased, I know the electeds from different jurisdictions have seen this in the past legislature, that there's increased requirements for different language access. The health districts were not included this session, but I would anticipate that we will be probably next session. So get ready. I know that BCC is, as well as City Council. Yeah.
And we are making every effort to.
The county is doing it, and we're doing it along with them.
Awesome.
Yeah. And Councilman, it's Spanish. And then there's a big drop, and then there's a lot that are pretty close to each other. So there isn't like a strong number 2, which is why I don't feel comfortable just saying like this is what it is.
Thank you.
Okay. All right. So then we're not going to go through this slide much at all, because Jack Centino is going to have the next presentation, which is a whole fiscal overview and includes HR. So we're not going to spend any time on this slide, just to let you know that it exists, but we're going to go into the details of it in our next presentation. There's just one point that I do want to spend a little bit of time on this one, and that is the revenue per capita. I want to bring that to your attention, because that is, I think there were some comments earlier about understanding that there's population growth, and that all of this gets our ability to serve is kind of dependent on keeping up with that population growth. So, and also to the comments that COVID means that we are in some trends right now that are just not going to be continuing, and didn't exist before. So on that revenue per capita number, in 2019, before the pandemic and all of that money came in for the pandemic, that was in between $51 and $52, just to give you a sense of how that is significantly different. If with the additional 2.4 million in state investment, that would add another about $5 per capita. And so, but that revenue per capita number is one we want to keep our eye on moving forward. So with that, we're going to suggest a break at this point in time. So Erin, do you want to talk about or Lisa? I'm not sure.
Yeah. Great. So as you may have seen, the lobby has been reconfigured. So would love for you guys to walk through it. What's going to happen is we've always had two separate check-ins, one for immunizations, which was out here, we called it the fishbowl, and then one in the back, which is family planning, sexual health. They're all going to be combined to this check-in. All staff will be up here, and we've been cross-training for months. So staff will be able to check in any client. And then they will, when they're up at a window, they will not be on the phones. We will have two staff in the back, which is just going to be so helpful for us. Maintaining two check-ins was brutal. If you had someone on, there was 3 people at each one, 3 to 4. And if one person was on vacation and one was out sick, we struggled with maintaining the business. So having everyone together and cross-trained is going to make a real difference for us. But yeah, we were hoping to move into this afternoon. We're delayed until next Wednesday. And it's funny, the clerical staff has not seen it. They want to be surprised. They want to wait till it's all done. They're so cute. So yeah, we're coming.
Yeah, so it's a quick tour.
Yeah,
I'll be back at 10:15.
We'll take 10 minutes, we'll do that, and then we'll be back about 10:15.
And into recess.
Recording stopped.
Okay, we're going to go ahead and reconvene our meeting. And
Recording in progress.
I do want to say that our fish tank, I guess, is the new name for it out there. It looks beautiful. What an incredible piece of work. So look forward to seeing that in action. Back to you.
Okay, just wrapping up this last topic, we did have this question that we started the topic with, wanted to come back around to. Board members, just to ask the question, are you getting the information that you need to govern effectively? Is there anything that we should consider, change, do differently from what we're doing? And the 3 reports were in the context setting for that. So,
well, I'll share the one thing I did share with Aaron. I'm going to go back to saying there's 2 pieces on this that I still think that should be on there individually. FTE on the different areas gives us the ability to look and say, this many people are serving this many clients, this many people do inspections, and it helps us as we look at the trends moving forward. And so that's something that I think, I know I see FTE at the end here, this is 179, and that doesn't tell me the individual areas that will be served. And that's just my opinion. I think it's something that would help me. And then I still think and I know it's only one area, but I think it does tell us on that area some pre-COVID numbers. So we had something, I mean, still stuck on that in my brain. Those are two things that will help us in the long future. I know that we already kind of talked, they're working on potential general numbers, and I think that's something doable. I don't think we need anything to, I know the levels of what you guys did here are really good. So those two pieces will allow us to quickly, for what we do, move forward. I know when it comes to dashboard for the public, those are two things they are probably don't care about. I'm talking for me. Yep.
I would say one of the things we also discussed is that FTEs we might not be able to go back to 3 years, but there might be something to go forward.
We don't need to go back. That's the other thing. I do want you to know that's not back information.
And I want to parking lot that just a little bit for the workforce capacity investment presentation and come back around to that as well there.
Other thoughts, feedback from other board members in terms of information you need to govern effectively?
I just wanted to say thank you. I mean, adding the district snapshot is an incredible lift, and it was a very creative approach to give us that holistic volume performance all wrapped up into one story. I think it's a really beautiful tool for telling our story. I was just confused. I thought the dashboard was going to live on a website where the public would have access to it, which is why I kind of got hung up on the language of it all. But can you clarify when we will see this, what time of year we'll see this, and how it will be presented to us?
And Julia, I'm going to pass this to you for a second, because I think that this, in the context of the other dashboard project, might be the.
So for the purposes of governance, this will be part of the year-end presentation that we always do on our strategic plan results. That is the roll-up of is the full report with all of the indicators of our performance management system. So the second report, and this would be added onto that as part of that presentation. So from a governance standpoint, that's where it's going to go. We were thinking about putting it on the website, making it accessible. So I think that's probably more conversation with Scott and his team, and understanding that the dashboard by itself is not enough, that there would have to be storytelling and context that would go with that. And so more to come on that. But before we go public with it, we would share that with you. And then I think the third place that we sort of see it being used is in public presentations. So like when the district health officer gets invited to the Chamber of Commerce and he's able to do all the storytelling behind it and provide context where there's spikes and things like that. So that's, I think, the three ways that we see use. Perfect. Thank you.
You know, your full-time employee question you asked about it going forward. You know, I know we share a lot of positions, meaning, you know, you might have one person working in, you know, public health that is shared with another, especially during the COVID procedures. Maybe going forward, those positions that we shared because we didn't have the ability to hire those other positions, so that when we look at in the future, especially trying to get those positions, FTEs filled into those. You know, how many times you have these employees actually filling into this other area because they were able to cross-certify or we're cross-certifying that. And then, you know, we may do, but here's what we really need over here.
I'm saying, because it's all about us equipping you to do, like Mr. East said earlier, you know, we want to set you up for success. Is all the only reason we want this information. So it helps us, what you just said, if you guys were sharing a thing, that's what we want to do, that's cool. But it might be doing that out of necessity where we want to just, I don't know how to show that.
Yeah, I don't either, but you know, yeah.
Yeah, I think, again, when we get to the third agenda item within this, the workforce capacity assessment, you guys are like so future thinking. I think we can delve into that a little bit more. It might not be this tool, only in that this tool has everything so rolled up. So like, for instance, when we're talking about inspections, we're talking about team members in Francisco's shop and in Rob's shop that have cross duties that their full-time job is not all that. And so there might be a different thing where it's a programmatic view that would make more sense than this very rolled up view. And so we'll move that.
Dr. Danko, do you have anything? Okay. Can you go, Reese? Good.
Okay, awesome. Thank you so much. So let's move into the next item that we have, and this is the second of three, so to speak. This is working. All righty. So fiscal overview and outlook. The purpose of this conversation is understanding of the current fiscal state, gaining clarity around the forecast and key decision points. Julia will be kicking us off this agenda item. And then, Jack, pass to you. Julie, go ahead.
So as you can see, our district health officer was on tap to do the table setting for this agenda item. So I'm filling in on this one today. Most of this is going to be Jack. So as has been noted multiple times during this retreat already, the health district is not living in usual times. And that probably the place where that is most reflected is in our financials. We've had a lot of extra money coming in because of COVID, and the word is not volatile. I think some of us lived through the Great Recession and that was volatile. The word is unpredictable. So COVID money is a part of it. Inflation, Corn Ferry adjustments with the market study that the county did. But we've also had things like the compromise in Congress that clawed back 2 years of STI funding. Like, it is just a very unpredictable environment for us. And so we thought that it was critically important that the District Board of Health had the time and the ability to see the trends. This one is one where we are going to do a comparison to 2019, so you can see pre-COVID and then see where we are today. And so Jack has put a ton of time and energy into putting together a deck for you that gives you that fiscal overview and tries to do an outlook. And I think he will say this multiple times, but that asterisk on that outlook is lots of unpredictable variables in the world of public health right now. But we do want you to see, because we have some unusual things that are happening. This is not any trends that the health district has ever seen before. And we have some strategic decisions that you're going to need to make during the budget process. And so we want to make sure that we're starting early to get you that information so that by the time we're at the budget process, you have all your questions answered and understand the decisions.
I have charcoal there.
So I'm going to turn it over to Jack, who's going to take you through a healthy deck to make sure that you have the information that you need.
All right. So I've gone through this a couple times. Apparently it's very information dense. I'm talking really fast, so I'm going to go relatively slow to the best of my ability. I'm going to stop between each section, and if there are questions, just chime in. I'll give everybody up in advance. I haven't told anybody this yet, but I always try to find something that helps me remember what each slide is. So air quality management is like yellowish brown for dust. EHS is a reddish brown for rust. CCHS is in navy blue for family planning. And I didn't get PHP, but I was going to do the emoji, the pukey emoji green. So there's little things that'll set it off through it. So keep those things in mind because there's a lot of information and I'm going fast, but I'll slow down as everybody needs me to. So just kind of an overview of what we're going to do. So I'll talk about 23 and I'll go kind of in depth into 23. Revenues first, expenditures, staffing, and then I'm going to go backwards to 19 and I'm going to zoom us forward again. So you'll see what's happening pre-COVID. You'll see what happens with the dollars as we go through COVID, and then we'll start to speculate or project as best we can into what happens over the course of this fiscal year, and then projecting out until about 27. And we go a little bit further out, but it's really speculation and it's statement of ongoing investment for public health. So I'll dive in. Any questions before I get going?
Can everybody hear Jack okay?
He's a little low.
Yeah, am I a little low?
Would you prefer to come stand here? Are you okay?
I'm okay. I can be louder. I can be loud. I try not to be, but I can be. Okay. So, and then tell me if you need, is this loud enough for you?
That's better.
Okay. All right. So I'm going to start with revenues. This is 23. So this is roughly what we do year to year. So charges for services, 3.8 million. It's 12% of the budget. So this is the plan reviews, inspections, clinical services, those types of activities. Intergovernmental, mostly grants that are in here and a good chunk of COVID grants at the moment. But in addition, there's a couple of things that are transferred over to us statutorily in that budget from DMV, tire fees and pollution control funds. And then the next one is the county transfer. So it's about 30%, 9.5 million. And that's been pretty consistent back to 2019, you'll see. And then licenses and permits is 13% of the budget. And this is the environmental work, the pools, for food service, those types of activities. So again, the lion's share of the money that comes in is through grants. And that 45% will look pretty different once we start getting into next year and the year after as the COVID funds start to fall off. So this is the same information broken up by division. So this is the roughly the revenue size of each division. So air quality at about 3.5 million, EHS at about 5.5 million, CCHS at 5.7, and EPHP at about 6.8. So these revenues for EPHP and CCHS will be different over the next year or so, depending on what happens with the COVID funding. But you can see that ODHO is kind of the smallest. Actually, AHS is the smallest because we don't bring any revenues at all. Thank you all for your donations. And then air quality, EHS, CCHS, EPHP in terms of size of revenue. So similar in size and some changes that we expect for COVID funding within EPHP and CCHS over the next handful of months. And then just a percentage. So this is the same information, just cut up in a slightly different way. So just rough percentages of the size of each revenue by division. Okay, this is expenditures. So the most obvious pieces are the baby blue and the medium blue there. So one is salaries and one is benefits. So about 68% of our expenditures every year right now is related to salaries and benefits. If you look at the orange, this is services and supplies, and that includes professional services, which have the contracted staff there to do COVID work right now. So that's under the contracted services line. So $3.6 million in COVID contracted related expenditures. When the COVID grants fall off, that dollar will shrink. So that 31% will shrink, and the amount of money that we spend, the relative percentage of money that we spend on salaries and benefits will be closer to about 85%. So within the next year and a half or so, when COVID grants fall off, our spend around salaries and benefits will be about 85%. Sorry, let me pause there and see if anybody has any questions, because I know that we went through the revenues and there's the gist of the expenditures. I'll just pause for a second and see if anybody has anything. Good. Okay. All right. So this is expenditure by division. So we looked at revenues, and now this is expenditure. You can see the lion's share goes to CCHS right now. And I'll show you more information that gets a little bit deeper into that. But the landscape has changed over the last handful of years, COVID related, and just as a community-based safety that CCHS is the 500-pound gorilla right now. EPHP 7.2, again, a lot of that's tied to COVID activity. AHS at 1.3, which is just salaries and operating costs for me and folks. ODHO at a little under 3 million in expenditure, air quality a little bit over, EHS at about 7 million. So this is a comparison of revenues and expenditures by division. So on the left side, this is the dollar amount. The blue is revenue, and the orange red is expenditure. So this is essentially the gap between blue and red would say that this is the amount of money that they bring in revenue, and then the dollar amount, the gap between the two would be administrative and the county transfer that makes up that difference between the two lines. And then on the right side is just the percent of the percent of expenditure that's captured by the revenue in each agency. So OEHO brings about 30%, 37%. AHS is at a lofty 0% because we're just indirect. Air quality actually has more revenue than expenditure for the year, so that money is limited to air quality expenditures in the future. CCHS brings in about 57%, EHS 80%, and EPHP about 94%. The numbers for EPHP will change pretty significantly after the COVID grants fall off, and there will be some changes around CCHS as well. And I'll pause one more time. Any thoughts, questions, concerns on this one? Okay. This is staffing. So from left to right, CCHS, EHS, CPHP, air quality, ODHO, and the mighty AHS at 10. So left to right, largest division, smallest division. In the back, in the dark blue, is the total staffing. In the orange is full-time staff. In the baby blue is intermittent hourly staff. And then the front is the part-time staff. There's one error in there. I won't point out what it is. It's minor. Questions on staffing pieces?
I think just to point out, we've said many times that CCHS is highly dependent on intermittent hourly, but like seeing that baby blue 56 intermittent hourly really tells that story.
And this is essentially the same as the previous one. This is just put into a pie chart to show a different view of it, of the percent staffing by division. So again, CCHS is the 500-pound gorilla right now at 51% of the staff. EHS is at 20%, EPHP is at 11%, air quality 8%, ODHO is at 6%, and the small but mighty AHS at 4%. And this slide is wrong, and I just chose to put it in there anyway. And the reason that I did is because some of the positions have changed, titles. There's been a lot of movement because of Corn Ferry renaming a lot of things and people shuffling around a little bit. The reason that I left it in here is because it kind of shows the breadth of the work that we do within the health district, that there's almost 250 positions within the health district, and there's about 50 different position types. So 1 in every 5 positions is a different type of activity that's going on. So real strong diversity in the work that we're doing on a day-to-day basis. This section I'm going to just glance over.
This is information that's in there for your reading pleasure, but we're not going to spend time on these slides. But it does take a deep dive into each division.
So this is just to wrap up 23. So 32 million in revenues, about 31 and a half in expenditures, about 248 positions. And in this case, I'm talking about positions, not FTEs. So we're talking about bodies, not the number of hours that they're working. And then a new piece of information, which is the health fund balance at the end of 23, which is at 17.5 million. So a really healthy fund balance at the end of 23. Okay, so that rounds up 23. I'll pause there again. See if anybody has questions, comments. All right, so now I'm going to go backwards in time. I had a bunch of clever slides that I put together to try and take us backwards, but I took them all out, so I just have to be funny by myself. So here's the health fund balance. So the far left would be the start of fiscal year 20. And then the white lines show 21, 22, and 23. And the far right is the close of the 23 budget. So you can watch the health fund climb. You can watch the moment that COVID hits. You can watch as everybody takes their day-to-day activities and pushes that activity towards COVID, and the day-to-day activities fall off, and those salaries and those other activities get reflected as the health fund increases in size over time. So this is the left side of that chart, which is 2019. So this is the more innocent time, $24 million in revenues, 22.5 in expenditures, 183 positions. and a health fund balance that was at about 7.5 million. And I'll show you the comparison here. Which I'm going to pause on this slide for a second too, because I think that this is a pretty stark contrast between those two moments in time. So the comparison of the revenues pre-COVID to the close of 23 of 24 to 32 million, the expenditures at 22.5 up to almost 31.5, and the 183 positions that have gone up to 248 positions, and the health fund balance going from 7.6 to about 17.5. Questions on that? Concerns? Comments?
Well, I think you're about to tell us the next piece. I've got me on a cliff.
Perhaps you understand why we prioritize this conversation.
Wait for it.
I'm waiting for it.
Okay, so this is longitudinal overtime revenues. You can see when we get into 21, there's this big bump in purple, which is the COVID funding that came in. But from bottom to top, these are the county transfer dollars at 9.5 million, licenses and permits at about a little over 3 to 4, depending on where we're at. Years, charges for services that trended up a little bit over the last handful of years. And then I smashed fines and forfeitures and miscellaneous between those two lines, really to just kind of show the fines that were related to the COVID activity. It's immaterial, but interesting to note at that moment in time. There's a little blip of yellow for fines and forfeitures. And then the purple is all the grant funding. And that giant spike again is the COVID funding that starts to come in. So this is expenditures. This is 2019 to 2023 again. The bottom is salaries and wages, and the medium blue is employee benefits. And I think that that's important to note when you go from 19 to 23, left to right, you watch that upward trend that we were at somewhere around $17 million in salaries and benefits in 2019, and we're closer to about 22 million or so at this moment in time. And then the light blue again is services and supplies, which includes professional services. So a lot of the temporary staff that are doing COVID-related work are reflected in the baby flu. And that's all to say about that guy. So this is total positions year over year. We started at about 192 in 2019, and we've gone up to about 248 for that period of time. And these are county staff, county positions. And this is the same information broken up by division. So CCHS, you can see there's pretty significant changes over time that we went from 89 staff in 2019 up to 127 that we have right now. EHS is pretty flat over that period of time. EPHP had a pretty big jump related to COVID activities. Air quality has been pretty flat over that period of time. ODHO has increased by 7 staff, and that's as they go into more programmatic activities than they have been doing historically. And, over that time, AHS got 1 more position. Okay, so that's taken us from 23 back to 19, and then zoomed us back forward to the edge of the cliff that I'm not going to call a cliff. It is a resetting of an emergency moment back to normalcy, whatever that means. So I'm just going to level set the projections just a little bit and just let everybody understand the number of variables that we're dealing with at this moment in time. Korn Ferry changed salaries for everybody, most people in NPH. We've got good numbers at this point, but not perfect numbers. So we've been fiddling with those projections for quite a while at this point. We know that we've got additional benefit costs that are hitting us. We've got the new positions that started in 24. So we did 7 new positions, and we took 3 community health workers and we put them into CCHS. So we made some adjustments in the budget for positions. The COVID funding is ending. There's talk about it ending this fiscal year. So by the end of June, there's some discussion that hasn't gone beyond whispers. I don't have any math at this point that would say anything different, but the COVID grants are going to end somewhere between this July and the next July, maybe if you speculate an additional year after that. One day at a time on it still. So there are positions that are funded by COVID that we have slated to move back into the normal funding bucket for the end of the fiscal year. And then we also have people that are billing directly towards COVID related activities. For example, some of Lisa's activity goes directly towards COVID work. Some of Nancy's staff goes towards direct COVID work. So we've got staff that are directly funded under it. We've got people that are allocating time to it, and those will end when the COVID grants end. So that'll have an impact on our budget as well.
Jack, let me just interject one thing here that I think is important. We are calling them the COVID grants, but some of those COVID grants have come with additional flexibility. So not all of those activities are still COVID. I think that would be a question that you would have, like, what are you doing? Because COVID is not the same thing, but there's additional flexibility that has been given in those grants to do broader disease and immunizations primarily. So I just want to make sure that part is clear. But they are still the COVID grants. They're just more flexibility to do more work.
They're functional grants though.
Yeah.
Thank you. And then federal clawbacks, we know that there's been a lot of noise at the federal level. Some of those themes seem to be targeting some of the programs that we do. We're waiting in the wings day to day, getting information from the state and the federal government as to what we expect in terms of funding for all of them, but it's a work in progress for sure. We're also dealing with the amount of money that we're talking about that came in for COVID related activities over the last few years is it's the biggest thing I've seen in my career. Dealing with that from a fiscal budget perspective and an audit perspective is a pretty heavy lift. So there's a lot of turnover at the state level. There's a lot of new folks that are coming in and dealing with this really complex situation. And what's coming out the other side is that it's hard for us to know what our budget's going to look like because people are dealing with these grants day to day, and we have errors that have to go back. We have a lot of time and a lot of labor that's going to try and figure out what's going on with these grants. So it's not helping us get where we need to be. We also know inflation's hitting us. It's been hitting us pretty hard. Fuel prices are going to go up. All those things that we deal with, keeping the lights on, is going to go up. We also dealt with staff turnover for the last handful of years. I may misspeak, but the numbers that I looked at when I first came in said that there about 40% of the positions that operate within NNPH has been here for less than 5 years. So we've got relatively new staff doing work. And the county transfer that we've had the same amount, even though the complexity of our work continues to increase. We're level funded from the county perspective since at least 2019. Okay, so with my caveats, that one's hidden.
Can we go back to that slide for a minute? Now a good time for me to insert a discussion.
Yeah.
This one. Yeah. So I have some thoughts about a couple of things on this slide, but I want to confine my comments mostly to the top one, the Corn Ferry, in part because it's the one I know the least about, although I am vaguely aware that the county and therefore we engaged in an outside service to do a comp and class study. I think all of our agencies have recently done that, Sparks and the city of Reno.
Ours is about 5 years. Ours is a while.
Years older. Okay, because we did ours. It was not with Corn Ferry. So, I don't, that name Corn Ferry makes me smile every time I say it. I don't grass and lawn would be like a corn husk or what, but in any event, because when I came onto this board, I was tasked really with a sort of not knowing everything about everything, but I am sort of the person for EHS and how we've divided the responsibilities. And I know from having spoken to some of our folks in the EHS world that there are some percolating and simmering and some ongoing concerns about how Corn Ferry has impacted our people. And I need more information, and I have reached out to Ms. Dixon and Mr. Dick, and we're going to be working on that going forward. I'm not suggesting that I can change what happened with Corn Ferry, how it impacted any particular group, but we do have some folks who are unhappy with how it has been applied to them. And so I want to be able to do a little bit more in that area. Again, not because I can micromanage or change the outcome, but of course I want what all of us want, which are happy employees. But my understanding, especially because although the county and therefore us relied upon Corn Ferry, we went through a similar process of the city of Reno, having hired some other group, and always with class and comp analyses and then reorganizations for pay scale adjustments. You know, you're making some choices about when they roll out, what date they roll out. If you pick January 1st, it affects a group differently than if you pick March 1st. You have to draw a line somewhere. But what I worry about is when we have people who are similarly situated in years of experience, and maybe they're making different dollar amounts. Sometimes people get a little bit of a bump for some other certification they had prior to coming to the organization. And I want to just make sure that I know everything I need to know to be a good policy maker. And of course, to really fight for our people. I mean, our employees are the most important thing that we do in this organization. And when I hear, you know, large groups of people or even small groups of people, even one person, I suppose, who are unhappy with how a thing is rolled out and applied to them, it concerns me. And it's kind of like the canary in the coal mine. So I have some work that I have to do, and the health officer and the assistant health officer are going to help me navigate that. And I think Manager Brown has been aware of some of these issues, and so probably will circle back also with him. It's also part of it is my own lack of full understanding about the nature of the county's sort of super role and then our role underneath it. And some of that is related to how you've identified county transfer dollars, but also that their HR really is our HR. We're not really an independent arm of a freestanding entity, but sometimes we like to act like we are. And so a lot of complexities here, but I just think that I, for my part, need to get more in the know about some of these issues so I may help add whatever I can to it. Again, I'm not suggesting that I have an answer or a solution. I'm suggesting that I want to advocate for our employees in a way that is meaningful to them. I understand too, and this was on an earlier, or maybe it's a later slide. I can't remember now. There's so many slides, but there was like an organizational analysis. You know, so many people in this division, so many people doing this, and when we have 280 plus persons, one of the things that I think I am hearing about the rollout of this particular part in our organization's movement is that some folks have been sort of slotted into management or supervisory roles when maybe they either didn't want to be a supervisor, or that maybe they do want to be a supervisor, but they want to be compensated a bit more for having to take on supervisory roles. So these are the things that I am thinking about as a board member and just trying to add some assistance to our larger body to navigate those issues.
My assumption is you're not looking for comment on that now.
No, I'm
just aware of that.
Fix it today. I'm just saying that this seems to be the point where I can insert my words into the conversation so that it is not a surprise to anyone when I have questions about things, which you might be like, well, why are you bugging me today? Or these are things I don't think that I I have tried to insert myself into understanding EHS. Everyone in that department has been very gracious to me to not only meet with me to answer my 1,000 million questions. I've gone out on, ride-alongs to do health inspections. I mean, these are the things that I want to do to be a better part of the body. And so this is just an example of that seems to be related to the topic we're talking about now.
And to that point, Councilmember Reese, I think walking through the rest of this presentation and then also making sure we have the time to get to that workforce piece that we've referenced a couple of times, which also will help the conversation you just noted. And I do have a parking lot going, so got those points as well.
Thank you. I appreciate the comments. And we've definitely spent a significant amount of time talking about Corn Ferry over the last year. Okay. So these are the revenue projections. These are the ones that were done in the budget build. So the up through 2023, that's the breakout.
I think you jumped past the anticipated revenues.
Yeah.
What's in?
I was going to make this slide invisible and it didn't make it there. Yeah. So there was a lot of discussion about this slide and I was just trying to come up with a dollar amount that we know that we're going to see, in addition to additional expenditures, we know that we're going to see some new revenues. So we know that SB 118 is going to give us $2.4 million for 25. At this moment, it's a one-shot appropriation. We know that the intent is to come back and have this as an ongoing source of revenue. We're going to fight for it during the legislative session. As of right now, it's reflected in my budget as for 25. I do some projections that include SB 118 in them, and I'll show them to you in a few slides. And then fees, we know that CCHS, those fees are completed. If utilization doesn't fall back because of our increases in pricing, we know that we're going to get about $300,000 in additional revenues for it. We know that air quality and EHS are working on their fees. They won't pull the trigger on those until July 1st of next year. So that'll be next fiscal year. But we know that we've got about $2.7 million in additional revenues, plus what we bring in new fees starting for fiscal year 25.
I would caution all of us, and I appreciate having the slide separate, because I caution all of us to, as we look at, we're fine here and here, this may just disappear. So 2.4 million, though that seems like a lot, it's not a lot. It goes away quickly. And so for us to lean on this staff-wise, it's something that can help guide us through this next season adjustment. But I wouldn't count on it was that as for anticipated future staff or whatever. I think that's what you're trying to say, but I'm here to agree with you 100%.
You articulated it much more clearly than I could. Thank you.
And the fees decisions, as always, would come back to you as the board, and you'll see them on their agendas.
Based upon approval.
Okay. So revenue projections. So everything that's shaded is starts at 24 and goes forward. The history that we just talked about from start of fiscal year 20 to 23 is on the left-hand side. I apologize for the bit of a triangle there that's in 24 that shows projected revenues for this fiscal year related to the COVID funding that we didn't know exactly what was going to happen. And I had only been here for a few weeks when we started building the budget. So there's a little bit of a triangle for 24. But if you take that triangle out of there, it's a pretty smooth curve as we start to project forward. What you'll see is the bottom is projected as county transfer. We've got some increases in licenses and permits, some in the charges for services. It kind of drops off. Some of that, I may misspeak on this, or I may ask Francisco for some clarity, but some of those charges for services were related to one big project that was a solar project that brought in some pretty good revenues for air quality a couple of years ago. And then everything that's in purple is the intergovernmental transfer, most of which is grants, but also includes some of those statutorily transferred DMV revenues as well. So any questions on the revenue projections here?
Well, the only question I do have, so you did not include the 2.7 you just mentioned in this check.
That is reflected in revenues for 25.
24.
Just for 25.
For 25, you did put the 2.7.
Correct, yeah.
In that. So if that, so we know, because we know that's coming, but then in 26.
So there are multiple scenarios later in the deck.
Okay, thank you.
Yeah, you'll see that.
My mind.
Yeah. Projection becomes speculation pretty fast. And there's, like I showed in the previous slide, there's so many moving points. And that was so new to this last year that these are our projections from the budget. Okay, and this is the expenditure projection. So same thing, we've got a little bit of a triangle in 24, but that is we weren't sure what was going to happen with the revenues and expenditures for COVID, but those two will balance each other out. So other than that, we've got a pretty smooth trend line. Same themes, salaries and wages on the bottom, benefits in the middle, and then services-wise on the baby blue. So we can see that we know that salaries and wages, benefits are, those expenditures are going to keep increasing over the next handful of years. So this is the health fund projection. So this is based on the budget build for this current fiscal year. So this shows that with the new staff that we brought in, with the ending of the COVID grants, with all of the changes that we expect to see budgetarily that we talked about earlier, this is kind of the raw projection that I started to build from. So this shows us needing an infusion of cash somewhere around the start of 27. So once we get a few years down the road, we need to make decisions about programmatic activity or the amount of fund that we're able to bring into the agency. So these are the original projections.
Could you explain the line?
Oh, I apologize. The black line that's going across horizontally is the reserve that we're required to have based on the county requirements, which is roughly $5 million. So when we get down to when the COVID funds end and we're back to the normal budget year to year, that's roughly the reserve that we need to hold ongoing. Okay, and this is the projection that shows a one shot from 118. So for SB 118. So this is if we got a one shot in cash to deal with any one shot activity that happens over the course of 25 without an ongoing investment. So this would be continuing to do our activities, investing in Northern Nevada public health in whatever form we choose to invest in. And then we would continue that trend. It would just kind of delay our course for a couple of additional years. So this one is the $2.4 million one-shot appropriation for 25. And if we had an ongoing investment of half of that over the ongoing. So if we hired staff at 1.2 million based on that one-shot appropriation, what it does to the health fund over time. So if we have ongoing expenditures and we only get a one-shot appropriation, it shortens that timeline to when we would need to make decisions about how we achieve equilibrium in the budget again.
An important point of information here is that the way that the legislation passed was that 2.4 could be spread over 2 years. So it doesn't all have to be spent in fiscal year 25. It could be spent over fiscal year 25 and fiscal year 26 at the 1.2 million number. That's why you're seeing the 1.2.
Okay. And this is the same logic at 2.4 million, that if we took that one shot appropriation and then we invested 2.4 million without an ongoing appropriation, that it's basically saying that's not a good idea at this moment in time. now. So this is I struggled with this one a little bit, and Kevin asked me to put this in, and I chewed on it for a while, and I like it more because as I stare at it, I think that this goes out to the end of calendar year 29, so midway through fiscal year 30. So it's speculation at best, but essentially what it says is that if we just take our numbers and run them forward, the $2.4 million worth of investment just about gets us back to equilibrium. It's probably closer to about $3 million worth of investment that will get us to that place. And if not, we'll have to make some decisions about what other ways we have to save money over time. So this says that if we get that ongoing investment from the state, we just about achieve equilibrium with resources that we have available to us. So,
So Joelle does her job well. No pressure.
It's all on you.
Well stated.
I just want to point that out.
Yeah, us and everybody else's revenue is looking bad. So things are going to be great next session.
Be a fun session. Okay, so that's the gist of it. That's the overview. That's 23. That's going pre-COVID, all the way zooming forward, and then doing the Wile E. Coyote moment of where do we go from here. So that's all that I had, and I'll hand it off to Julia.
All right. And so again, sitting in for Kevin. So that's the facts. That's the data. That's our reality. These are our strategic considerations. So as we are thinking about, because we have choices. I mean, normally in a budget cycle, you have some trend on your revenue, you have some trend on your expenditures, you have some modest adjustments you have to make. But we're kind of in an extraordinary time, as we've talked about. And so there are some things that we want the board to start thinking about. And again, not looking for direction today. If you have some thoughts, we'll be happy to collect them. But over the course of the budget build, some things that we need to consider. So one is, as was noted, Joelle did an extraordinary job in the last legislative session and got the first ever state general fund dollar investment in local public health. We're 50th in the nation. One of the things that we would like to do is position ourselves well to continue to get that. And if we don't show some investment that demonstrates to the state the need for that money and the impact of that money, and we go down to the legislature and say, well, we had a healthy fund balance, we didn't invest it, but please continue to give us money, that may not be the most strategic way to go. So that is one thing that the board and management leadership need to be thinking about, is what are the investments that we'll be able to demonstrate. Understanding, of course, timelines. By the time the legislature's in session, we won't have a full year, but we will have to be able to tell a story. The second thing to consider, and just going to choose to believe that it's not awkward that the county manager is sitting in the room for this presentation.
Oh, I'm glad he's here.
Is the county transfer. So the county transfer is flat and has been flat since 2019. So obviously with a flat county transfer every year that goes by with inflation and those sorts of things, we are losing purchasing power with those dollars. And the county transfer hasn't always been flat. So, going back, as was kind of noted, we are an independent unit of government with our own governing board. There were decisions made back when the health district was first created that the 3 jurisdictions would work together to have one health district. And at that time, there were some conversations about tax transfers that helped to support some of that funding. Honestly, a lot of that institutional knowledge is lost. It's not well documented. So there is this conversation about there is the county transfer. It is flat. That has been okay with us, just to be very clear, because our ending fund balance has been in this place for the last several years, that it wasn't a critical issue. But as you can see on the sustainability path going forward, it's probably time to start having a collaborative conversation with the county about, once we get past this weird place that we've been in with COVID, if we were just to stay flat, that 2.4 doesn't get us anywhere over time. It will just we will just be shifting for it as opposed to being able to enhance. So with this information, with this data, with time, because we do have a glide path, this is not a urgent, has to be fixed tomorrow issue. It can be fixed over the next couple of years, depending on the scenarios. But it is important that we're having a good collaborative relationship, conversation with our county on that county transfer, because if we're going to maintain sustainability, being flat is obviously not sustainable. Cost recovery is something that we need to own our own on. And so those fees conversations that we have every year or every so often when we're updating our fees, some of the data that Jack was able to provide you was kind of the cost recovery slide. So some divisions are able to bring in more cost recovery, some are able to do less just by the nature of the work, but that we should make sure that we are owning that we are doing cost recovery where cost recovery can happen. So that also is a good conversation then with the county and the state regarding their investments. We know that we're doing what we can on our own. And then finally, that workforce investment is our identified need, right? We know through all these capacity assessments and all this work that we've been doing around our workforce capacity and how it matches the foundational public health services and the needs for community-specific investments, there is still a need to invest in our workforce. We still have people who have span of control issues, workload issues, to do the current work as opposed to investing in new initiatives and new programs. So this is the conversation that you should anticipate in the budget process. If there's any initial questions and considerations, this is the time to really get clarity about our current situation. And then if there's any guidance or considerations you want to share, please share.
I'd like to open this up here with this slide up. I have a couple thoughts, but I'd open it to the colleagues first to see if there's any thoughts, or do you want me just to move away?
No, I'm happy to say that County has been an incredible partner.
100%.
And I see it in regional collaboration all the time, every day. So I appreciate their leadership because there have been a number of important lists lately that are regional where the county has been the leader in the space. So I just say, obviously, what we're all looking to do is provide financial sustainability to this body and this organization in order that it can do some of the things it needs to do. And I think we have all come to acknowledge that, the public health issue has been at the top of mind for the last several years, not by our choice, of course, but now I think there is no backing down or lack of acknowledgement of the importance of it. And that regional approach has really got to be where it is. I think Ms. Gutman-Dotson is also very instrumental in helping us in the legislature to have some of these conversations, and those will likely have to continue. Finding additional funding sources that are not always being asked of the county, I think long term is important too. And so perhaps that will be what we focus on there. And I know that's not in particular identified here, but the state investments have been large, but those have to continue. So whatever advocacy we can do towards that. But I just want to focus on thanking the county and being transparent about it.
I just want to bump through real quick and I don't want to say in priority. I not this priority list, but in my mind, I think the state investment portion is top to my mind. And I say that I do believe our state's at a place, though they will be tight financially, they do like the idea of us being whole and ready for anything that might come, like COVID or anything like that. So it is the time to show and prove. I think you did, as we said, did a great job, but I do agree. And then I would say, though I'd actually put this towards the end, the only thing that, I would like to say, even though finances have not shifted since I've been on this board, I do believe the county has walked hand in hand with us. Maybe finances haven't gone up, but support has always been there. And so I have one ask to consider, though, depending on how all this other stuff goes, is that the corn ferry is looked at as a potential from, I say this, it wasn't our idea to do the corn ferry, so it's kind of almost like on a state level, you're called unfunded mandate kind of idea that we had no choice in. However, we could get there, it's cool, but I would ask that it be at least looked at as we walk out, that the county considers that as maybe a potential, if there's a bump, that we look at that as potential need. Again, I would put that towards the end. I think cost recovery is obviously something we're working at making sure with our fees that we're being wise, that we work within the things we've been given, which I know has already been worked on, and you guys have done a good job. And then this workforce investment, my main question I do have, and then is we ramped up during COVID with this hiring. Now in typical outside here, I know these are human beings, but let's for a moment just look at the job. Do we need all those same human beings? We need human beings across the board. I don't question, and I'm not trying to talk about a particular job. This is the hard part about what we do. With us coming back to a norm, part of the reason this is so high is that we added 40 employees to this one area. Obviously, we want to serve our community. We don't want to overwork people. That's not at all what I'm saying. But there might be some areas that we don't need to do anymore because it was done. Is that true, false? Am I asking a question that's difficult to answer?
So I'll just take the first crack at it, and then Erin, I'm looking straight at you. But I'm smiling because I've said this to you like 5 times in this retreat, but it's the next agenda item. So the whole next agenda item is about workforce investment and how we're making decisions about who we do need to retain and for what reasons. So the short answer is no, we clearly don't need to keep all of those staff. And our next agenda item is our methodology for how we're making those decisions. But Erin, if you would.
That's what I was going to reiterate. That we've had these conversations and we're being very strategic about how we're going to move forward.
Thank you. I should just keep on it.
No.
Maybe 7 tries, but now we know what you.
All right, so
I do just want to highlight the cost recovery. We just completed the CCHS fees. We are going to be moving forward, and you're going to see some air quality and some environmental health fees coming before you. I know it's always a difficult conversation, but we have heard that you want cost recovery, and we are moving forward with that. It might be some difficult conversations, but it is coming forward in the next few months.
Yeah. And then I think I would just emphasize that staff 100% agrees in terms of the relationship with the county. We could not have made it through COVID without the direct partnership from an emergency management level, from the ongoing support, all of those kinds of things. And there is not a contentious conversation about this. It has been it hasn't made sense. We've had a ending fund balance that was healthy. So I just want to make sure that is very clear. And it's the glide path of, as you see those that go down, that allows us to have a good multi-year conversation about what does sustainability look forward. And hopefully part of that will be getting the answer to the state dollars and having a better sense of that.
And I just say one final, I think a glide path is really important to have as well, because if we're going back to our state and we keep showing this huge ending fund balance, right, they're going to say, why are you asking me for money? And because we're like, there's no reason. So I do think that it's wiser for us to have a contingency fund that makes sense than some large fund.
So the concluding question on this is just, are there any additional considerations that you would like the staff to look at as we're starting the FY25 budgeting process? Clearly, this is not just about the FY25 budgeting process, but a broader look. But if there is anything else the board would like to see, that would be the time to let us know, or of course the process will move forward. But
I think at a very simple level, it's, spend the 2.4 in 1 year or spend it over 2 years. I saw some nodding over the 1.2 on 2 years. Is that generally makes sense to folks?
I think be more conservative is wise. So
yeah. We have the ability to do that in the legislation. It's straddling that strategic investment to demonstrate that we're using their money, but then also not setting ourselves up to fall off a cliff. So generally that's guidance.
And I think you'd understand it as we explain.
Okay. So the agenda item that we
also started here.
Apparently, it's fantastic, and it's labeled workforce and investment.
As we were preparing for this, I commented that the word investment isn't a normal word that we use in a regional government conversation. But that is the perspective that this topic is umbrellaed under in the context of investing in workforce capabilities and capacity to deliver against the priorities of the health district. So we are looking for the purpose of this, and Julia will walk us through this, is to gain an understanding of the process that the staff, that the directors have gone through, and how they've landed on where investments might be needed. So, and it's specifically, again, around staffing and capabilities and capacity, not around infrastructure. So just to say that.
There, before we move forward, I want to note for the record that Michael G. Brown left at 11:50.
Okay, so again, sitting in for our district health officer for the purposes of this particular discussion. This will also be a collaborative discussion with more input from the division directors, similar to the first item that we did on the new snapshot and governance and information. So we have been doing a lot of work around trying to assess our workforce capacity, trying to benchmark ourselves against national standards, trying to look at the where is public health headed and where do we need to be ready to lean in. Probably, obviously, endless amounts of learning from the pandemic that we've all just experienced. So we've been spending a lot of time in this space. So I want to remind you, we went over this at the last retreat, but it's been a while. So I want to remind you of this process that we have been choosing to use to help determine these investments. So nationally, there is a model called the Foundational Public Health Services. And so this comes out of during the time that the Affordable Care Act was being considered. And as part of the Affordable Care Act, there was this concept of essential services or essential benefits, where there would be a core group of benefits that in healthcare, we as a nation agree that these are the things that all people should have access to. And so therefore they should be covered under your insurance, right? At that time, public health said, that's a great idea. We should have a conversation within public health or what are the foundational public health services? So healthcare is one aspect of it, but public health is a different aspect of it. And there are foundational things that we should be doing so that we can have great clarity about the role of public health and what those foundational elements are. And so there's good work nationally that we presented to you at the last retreat, where people have been comparing their workforce to those foundational public health services to measure, are we doing a good job of meeting that core baseline level that public health should be investing in, that every community should be able to count on. And so there's a staffing up calculator that is data collected from health districts across the nation that gives us a benchmark to which we can compare ourselves. There's a foundational public health services process where we have done this work on a data dictionary and a worksheet. And in that, and this was to your prior point, Councilman Dare, or Chair, we go through every human in the building and we apply them to which foundational public health service they are serving. So done that analysis on my position and every other position. So not by program area or service delivery, but by the capacity and the program area. So we'll show you that in a little bit. And then we can take that and we can see what our gap is to the national standard. So we have an identified gap and it's done by foundational area. So we know where we may be falling behind, where we're going ahead. After that process is done, that becomes a data point in a priority setting activity that leads to the recommendations that we bring forward to you as the District Board of Health in our above-based requests. So we have worked on an organizational development tool that is a collaborative and collective exercise of the leadership of the health district to rank what are the most important things that we're working on as a health district right now, and then to do some scoring that actually then brings you forward. This is the position that we are recommended. So to your last question, do we need everybody? No. And this is the tool that we use to decide what we need to maintain. And then that's a kind of a one-year process. It gets updated every year. There's different considerations every year based on the environment or what's happening. But we also know that we need to think strategically 3 to 5 years out. And so we've gone through another organizational development process with each division to identify where do they think their staffing patterns will be going for the next 3 to 5 years. And that is a visioning exercise that last year we did in-depth with each division director and their direct reports. And this year we just did a simple update. The environment hadn't changed dramatically, so we just relied on the wisdom of each division director to be able to update that, because there have been changes. So for example, the clawback of the STI dollars changed where the priorities were, for example. And so that turns into an internal strategic investment map. Not something we're really interested in sharing all that publicly, because it is dynamic, it changes. We don't want to give anybody the impression that this is a guarantee where our staffing is going to go, because the environment is dynamic, but good thinking at the leadership team level of where our likely future investments are going to need to be. All of that gets repeated annually in advance of the budget process to make those collaborative recommendations to you all to say, this is what we think we should be investing in this budget cycle. Okay. So, please. There we go. So just a reminder of the foundation. So when I talk about this, that coming out of the whole public health world of agreement. And so FAB, of course, our accreditation board is part of putting some of this information, national foundations and organizations. And so there are two main things. The foundational capabilities are on the bottom. So these are skill sets, tools, competencies that we need to have in public health: assessment and surveillance, community partnership development, equity, skills and competencies, organizational competencies like strategic planning and financial and those kinds of things, policy development, which is critically important in public health, accountability and performance management, which you've seen, we've invested a lot of time in our performance management systems, emergency preparedness coming out of Nancy's team, and communications clearly coming from Scott's. So those are the skill sets and competencies it's essential that we have ingrained in our work. And we have ingrained at a sufficient level, not only to be able to meet the needs of today, but also to be able to surge in times of crisis. The areas where we focus, these are the clearly identified, agreed upon nationally areas where local public health districts should be investing their time and energy. So communicable disease control, again, we probably all know so much more about that than we ever thought we would. Chronic disease injury and prevention, being on the front side of things and trying to prevent as opposed to treat like you would in healthcare. Environmental public health, which you see in our AQM and EHS divisions. Maternal, child, and family health, again, sort of trying to get on the front end of issues as opposed to waiting for there to be problems later. And then access to and linkage with clinical care. And I think Lisa did a great job of describing there's some safety net work and some public health communicable disease work that we are in the direct clinic version, but we also have a role in making sure that there's access to care more broadly in our community. That is what is expected of public health districts. And then there's this one line, and if I were queen of the world, I would change this graphic to make it different. But there's that community-specific services at the top, and it recognizes that every local community is going to have their own local specific community issues. And that may be different because of the infrastructure of our state, what our state is doing. And so, for example, in our world, our entire air quality management division falls under the community-specific services, because it is not typical that air quality management lives within the health districts in other communities, but it is for this state and works for this state. And across the nation, in most communities, about 50% of their staffing is community-specific services. So you have about 50% that's going to meet these core foundational areas and capacities, and another 50% that are responding to the specific and meaningful needs in their communities. That's the model. Maybe we have any questions about the model? We went over this last year. But it is a driving piece of understanding our scope, if you will, and where we should. Okay. And then it's all wrapped with equity. Equity should be built into, we have a growing and pressing need to address health disparities and to be doing it with an equity lens. All right. So this is just the reminder that last year we presented this whole process, but we do an evaluation of every single position and how they are allocated to all of those foundational areas and all those foundational needs or community-specific services. We compare that to the national calculator, which gives us a gap. So that first gap is the need compared to other health districts. Then we move on to do a local analysis to make some adjustments for services that are provided by other entities. So for example, in chronic disease prevention, we know that we have some wonderful nonprofits in our community, like the Lung Association, Heart Association, and others who are doing chronic disease prevention work. So we sort of bump down what is our need to be in that space, as an example. Then we do some weighting. So just by the subject matter expertise in our leadership team, should we be bumping up one of these categories or bumping down one of these categories based on our community conditions? So we do some prioritization. And at the end of the day, that gives us an adjusted weighted gap of how many positions we are short to be able to meet the foundational public areas and capabilities. So last year, so now that gap is at 29. So last year, that gap was at 32.67. We added 7 positions from our above base request last year, and that gap is now down to 29.18. That's progress. So that's good news. You note that we added 7 positions. It didn't go down by a full 7 positions because the rest of that 7 is community-specific services. So that's sort of the investment into our foundational capabilities and areas versus the investment into community services. Does that make sense? All right, so then we have our strategic investment map process. And so this is where we are. This is where we would like to go. So we use a prioritization process that has shared priority considerations for new investments. We do a visioning exercise. We do a collaborative ranking process, and we do above base budget requests. These are all organizational development tools that we are using internally to make some of these organizational decisions. So for the strategic investment map, there are data inputs that each division is considering when they're looking at that. Obviously, we invest a lot of time and energy in our community health assessment that gets us secondary and primary data about the health needs in our community. We do our strategic planning process with you, so we know what our top priorities and goals are. We do that analysis that I just showed you, where there's a data point on what's our gap compared to the national organizations. We have some priority considerations, which we're going to share with you. And at the end of the day, there's leadership judgment that gets folded into that. That then creates these strategic investment maps that are about 2 to 5 years in length. And then we do our annual above base requests based on that process of all that data. Turns into, so the shared priority considerations was a collaborative conversation with the leadership team to talk about what is it that is most important for us to invest in. In the first year, we did all of the first ones, and our learning was customer experience should be added in there. We weren't considering customer experience, so we should add that. So this will be the list of priority considerations we're considering when we are talking about our above base requests for this next fiscal year that we would be bringing to you. So I'll open it up to the division directors here. Is there anybody that would like to talk about just the process of identifying these considerations and understanding what's important? We did this before we're talking about any individual position. These are our priorities before we're talking about positions. Anybody want to comment on just this part of the process?
Yeah, I'll probably start it off. And Julia's a very good speaker, but I don't think it really gives it enough credit to how much of an improvement this process has been in how we make strategic investments within our organization. Speaking from the division perspective, some words that I kind of use to describe it was collaborative, forward-thinking, data-driven, strategic, and it really aligns with our organizational values. So I really want to kind of send a thank you to the health officer and Julia for kind of recognizing that there was tremendous room for improvement in how we were making these decisions. And I think the foundational public health services model really kind of provided that kind of step to taking that next improvement. This is speaking from a division that really is not primarily included in actually the model. But just the process, again, was super inclusive. I know there was discussions as far as should we have individual discussions with each divisions? And I think the credit goes to the leadership team that we have here as far as we agreed that we would come to the table together and have these different conversations and really support one another. So again, I can't say enough really good things about it. And I'm really looking forward to kind of continue to use this tool and help guide us kind of with strategic investments moving forward.
To that, I echo everything Francisco said, and we actually were talking yesterday about how the process used to look. And I know it was during my meeting, my one-on-one with Kevin, he'd say, okay, what are you looking at? And I would tell him, but I had no idea what Francisco needed, what EHS needed, or what Nancy's team needed. So this was a great way just to hear it all at one time. And our leadership team is very collaborative and we get along very well. So we all wanted to hear what everyone else had. And I think it's important for us to have this at our level so that we bring that down to staff that we're collaborative. This is what we expect for our agency. We expect that we work together and are all on the same page.
And I'm just going to add to that. So I definitely agree echoing the collaborative process and how this is a huge improvement. And for us, well, at least for me, being more of a data person, I really appreciate having that quantitative process in addition to a qualitative process to speak this out. And as Lisa has said, that division directors work really well when we're actually in the same room together, talking to each other rather than thinking about our goals and how that's going to benefit the health district individually, but as how we collaborate and how we're going to help the health district together. And then this also puts in a consistency that we wouldn't have had before, and having a consistent process really also help us disseminate to staff on how decisions are made.
You help us greatly by doing this as well. I just want to say this at large, all of you, when it comes to us making decisions, we know you guys already done a lot of processing where we're not having to go through and be like, well, I appreciate you need this, but what, it's good.
I appreciate that. We, of course, had some help with some external consultants who helped us through the Foundational Public Health Services part of it as well, but also helped with some of these tools. So I will just say that all the priority considerations are important, but if everything's a priority, nothing's a priority, right? And so then you have to go through some process to say, well, in this cycle and this year of all these priority considerations, what are the priorities for us right now? And so we use this very wonky tool that I would have never come up with, but that is a great data-driven tool where each of the priority considerations are ranked against each other. So is it more important to maintain our existing staff, or is it more important to meet a new community need? Is it more important to maintain our existing staff, or is it more important to meet a new mandate or an existing mandate? So they all get ranked against each other. And then once you go through that process, it ends up with a final ranking. So again, it takes out like the loudest voice in the room, or like some of the group dynamic things, but we all do it together. We rank them together. And then what we ended up with in our last ranking in 23, that we were still in a place where span of control and workload were our #1 tied priorities. And I think coming out of the pandemic and fatigue and everything else, that will continue to probably be true until they are accurately addressed. The third spot went to capabilities. So those are those foundational capabilities. I think readiness and knowing that we can respond is really something that is very important to the group. And then fourth was maintaining some of the existing talent. We had put all this time and energy into developing this talent, but these extra team members that we've been able to have through the last several years. And it would be unfortunate to lose some of that investment that you've already put into training and developing people. But you can see it ranks out through all the considerations. And so then those are the top considerations that we use as each division director brings forward their position requests to that collaborative space. Those positions then each get ranked on, well, this position ask that you're making, how does that help us address span of control and workload? And if it does, then you get 3 points there. How does it help us address capabilities, which was our next priority? And if it does, then you get a 1. So obviously you get less scoring as we go farther down the ranked priorities. And then what we get is that second to last column, which is a rank on the end of the position #4 was the #1 from a ranking process. And then we allow, because we are not robots or automatons, we allow for leadership, thoughtfulness and thinking to go in. And so there's a couple of adjustments that are made in the last column based on the collaborative conversation in the room and knowing that, yeah, that scoring worked, but I would tweak this a little bit. And then based on the revenue that's available, we fund as many of those or put that request in for as many of those as we think are possible. So kind of to your prior question, Chair, how important is maintain? Well, maintain was 4th. So if we're choosing to maintain a position over a new position that would address the span of control and workload issue, it's not going to rank as much, right? And so there's X number of resources. These are the priority the team collaboratively set, and we work through that process. We're not gonna be able to keep everybody, but we hope to be able to keep some. So just kind of thinking a little bit ahead to fiscal year 25 and along, we haven't done this process yet. We will do it as we have a better sense of our revenue picture and if there are going to be additional positions to be asked for. But we will do it before the budget process, and the above base requests that we would ask for you will be based on this process. Reading the tea leaves a little bit, maintaining talent certainly is going to be something that will be significant for us. Continuing to address span of control and workload issues will probably pop again. Increased investment in those foundational capability areas so we can make progress there, and increased investment in community-specific services are likely to be part of the conversation. Expected impact, all of this for us is always about increasing and improving those layers of community protection, taking us all the way back to the beginning of our retreat, that first slide and that snapshot, those layers of protection, and making sure that we can increase and improve that, making sure that we're meeting the customer services, things that Councilman Reese has pointed out, like that's part of what this is for. Program-specific investments that improve our community's health. And then finally, making sure that we have community-wide initiatives that are providing equitable opportunities for better health. And those all translate into, that's our mission. Our mission is to improve and protect our community's quality of life and increase equitable opportunities for better health. And so that overall mission is driving and guiding that very strategic, methodical, consistent process that we're now using to choose where to invest in our workforce capacity. So with that, any questions, comments, guidance on, and I appreciate Councilman Reese's, like, you're in the governance lane, not the micromanagement lane. But we felt like pulling back the curtain on these management and leadership processes, particularly in the context of the financial place that we're in. So you understand how we're approaching it. Not, hey, we got $2.4 million, let's go figure out what we want to do, versus this whole methodical process of how do we invest and when do we invest in that.
Span and workload obviously rose to the top. Can you kind of tease out the differences or maybe similarities of what that looks like and how it plays out in actual day-to-day operation?
Sure. Span of control, the county has a general guideline that nobody should be supervising more than 5 to 7 people. It gets a little bit more complex in that we have a lot of working supervisors. And so in that case, if you're also carrying a workload and doing supervisor and management, maybe that span of control needs to be even lower than that 5 to 7. So that's the span of control side, as we have some supervisors still. I think our worst is still supervising 10 people.
I would put 11.
11, so not sustainable, doesn't make for good management, leadership, mentoring, coaching, all kinds of things that we want to do. So that's that one. And then workload is more of an assessment of a staff member's just got too much workload. So some of the things that will come into that are like the performance management indicators that we looked at. If we're not meeting that turnaround timeline, like was highlighted earlier, is it because there's a workload issue? And so therefore we need to be adding more resources there to up the workload. Do we just have some people that are chronically facing burnout and fatigue? Do we have a lot of overtime hours in a certain area? So all kinds of things that we would be looking at to determine are there positions within our organization that have a workload that is inappropriate?
I think it would help us as you guys process this, and I know you're doing that in the future, but it'll help us understand as you transition some of the workload out of the heavy COVID hires and transfer them or move them or whatever, so we can understand and do our own. I mean, at least for me, I'm constantly internally projecting at any board I'm on what the future looks like. And then I also see your numbers as well, and I'm constantly, it's one of the things I do. And so as you guys process that, it'd be nice to see that. So I can have an idea, I'm not here to tell you where that's why we hired you all to figure out what's working for you all. I think it's a great process, but the more information as this goes, you continue to give us the help. Hope that makes sense. But I'm not asking for new work; it's what you're doing. But I'm saying it right. The sooner we can see some of the guidance of what you're thinking, right, the easier, at least for me, when I'm visioning the next 2 or 3 years look like, and where I need to put emphasis on some of the priority strategy of pushing this a little bit more. That can
Looking to Aaron to verify, but I would anticipate, and probably Jack, but I would anticipate in this particular budget build, you are going to hear a lot about the transition out of COVID because it is that time now. And so there will probably be quite a bit of information there. I think Jack sort of alluded to, we are still not really hearing if the COVID grants are going to end or not end. And so some of the detail around that transition is a little bit more challenging. But with the COVID grants adding more flexibility, that has allowed us a period of time to have those folks working on other things, which also gives us some lessons about capacity, if that makes sense. So we've had some opportunity to apply some of that. We aren't going to have to go hard stop COVID now this, right? So Aaron or Nancy, would you add anything to that?
Well, I think especially with the COVID grant right now, allowing some of other chemical diseases being also helping us with investigation capacity, because we have been on a very stretched for our disease investigators, our epidemiologists, and receiving diseases. That definitely sheds light on how much that would be. I don't have a specific number. That's more of an assumption that we will have when it comes to above base.
And it will be fully incorporated into our next budget conversation. It won't be a separate item.
Right.
Okay. So, Claire, would you like to, we have one more item to walk through. I know we have a loose stop at noon. So we have about 15 minutes. It's up to you whether you'd like to take this item or the board at large. If the board would like to talk about succession planning now, it's probably about 10 minutes.
It's also something that can very easily be done at the next board meeting.
It can, absolutely. So it's really up to the board.
Well, if we could actually push it to the next board meeting, I appreciate that. I have an EDOT. I don't know if you know, that's you.
We're late already.
Right, we're late, but I'll say that we can put it to the board meeting. It's an important conversation.
We just do it at John's.
Is that okay?
Sure.
Yeah. We kind of anticipated that. It's a lot of dense content.
We did.
Yeah. Because I do want to give it proper, I'll talk about it. This is actually very interesting conversation.
Absolutely.
No, that's perfect.
So with that, knowing that there's another board meeting pressing or another meeting pressing, we definitely got your feedback on what you're looking for from the workforce and investment piece. That was awesome. Sling you the fiscal overview and specifically on that 2.4. So that was a one piece of direction, which is great. And then certainly on the timing related to the reporting and also some feedback on the snapshot. So that's what we were looking for. Thank you very much for your time. And a huge thank you to the directors and all of the staff and Julia, that just so much prep coming into today. So just a huge, huge, huge thank you.
Do we need to make any motions or?
I'm going to leave that to the board. You know, we have to impose that open meeting law framework, even in an informal process. But unless you feel there's some specific action, I don't think you need to make a formal acceptance of the presentations.
Yeah, I don't think we had any. We don't have no. I think you got the heart of the conversation. Anybody listening would. I don't think there's any direction given at large, unless a board member would disagree with that. I think I'm comfortable. But I would say, is there anything the board would like to share before we're done as we close out this go to board comment? Well, I just say thank you, and I think I can speak for all of us. This is very helpful. It does lead us in, kept the cliffhangers going. So, so well, thank you so much. And I'd say with that, our meeting is adjourned.
Well, I guess there's